Meeting Wednesday, March 25th, 10 a.m. On the agenda, we have update from the county emergency response team on COVID-19. I do have a request. I believe we have, and I can't tell necessarily who's on here, but if Kim Gonzalez is on, my understanding is she'd like to go first. She's with the visiting nurse, and she was going to update us on the efforts in childcare coordination in Dubuque County. Okay, Kim, you're unmuted. If you want to go ahead and give your report.
Sure. Can you hear me?
Yes.
Okay. Just a couple of things. A couple weeks ago, we got guidance from the Iowa Department of Public Health, Healthy Childcare Iowa. They had sent out guidance through IDPH, and that was something that I shared to all Dubuque County providers by mail. So they all should have received it, anybody that was on the DHS website. So they should have received that letter along with my contact information. Most centers know who I am and work with me for QRS and other, health issues. So most of them know me. Some of the home providers know me as well, but that contact information went out 2 weeks ago. Last week, I sent a letter to Tara Roddick, who is the Child Care Resource and Referral Director here in Dubuque, and gave out more information that was pertinent to child care providers for COVID-19 that was sent out to all Dubuque County providers that Tara has emails for. So that went out last week. So they do have that contact information again. And so she sent that out. Today I'm going to be starting to make calls, personal calls to each provider type that I have contact for. I have phone numbers for, just to reach out to them to see if they need anything or if they have any questions, they need any support, so I can gather that information to get them where they need resources, or if we can gather any other information that they may need. So that's going to start today, and I would like to try to make sure that they have everything that they need at this point. So there's a lot of questions out there, I'm sure. So that's going to start today. And CCR&R has been gathering the list of closures along with DHS, and they're working very closely. And I'm also working with CCR&R locally and with DHS, our DHS consultants, for both home and centers. So but they are gathering a lot of information. They have a list of closures, CCR&R does, and they're gathering a lot of information as well. Again, I'll just plan on sending out timely information to the providers as needed, either by letter or by Tara, to get that information out as things are updated. I have been fielding calls from both centers and homes, so they do have questions, as everybody else does as well right now. And I'm working with, like I said, the IDPH at the state level with Healthy Childcare Iowa, my state liaison person there. DHS did release a new guidance on 3/20 that is on the DHS website, the COVID website, for guidance for our child care providers. And that includes, I'm not sure if anybody is familiar with that or has seen that, but that is there on their website under the COVID page, and it gives guidance on what child care is needing to do. So to stay open, any DH or any center or home that wants to close, they need to contact DHS as well, so they can work with them on that. And a couple other things. I had mentioned DHS is collecting data, CCR&R is collecting data as well to help support our providers. And we have been receiving at the VNA some essential providers, as in business. They've been phoning into our office to report the number of presumptive or potential child care slots that they may need. If they need immediate care, they're being referred immediately to CCR&R to find that care that they need. We have been getting some calls. Sarah Herzog is collecting that data for us, and so we could use that for planning as you need that information. So that's the update that I have at this time. Any questions?
Questions for Kim?
I have one.
Ann?
Yes, Kim, thank you. I know you're probably also aware that we have influenza out in our daycare centers in quite large numbers as well. Are we providing any support? Parents are panicked because influenza seems a lot like what they might be hearing about with COVID-19 as well. So are you providing any, response to them about that outbreak?
Right. I think they have a lot of the information. I certainly, can share that information. There is information. I know a lot of them are preparing. They have their emergency prepared plans too, as far as the pandemic, and they're looking at that, and I'm trying to help them with that as well. I don't hear too much, honestly, about the influenza as more of the COVID-19. So that's something that they do every year. Influenza does hit centers. And so I haven't heard too much, honestly, and from them on influenza. So they're following their exclusion guidelines. They have their policies in place. They've been, very good about following those. And that's something, again, with DHS directing, if they have a fever, they're taking their temperatures before they come in. They're social distancing. That's one of the directives from DHS. So, and following their exclusion policies. But I have not honestly heard a whole lot of questions about influenza at this time.
Right. I guess I'm just suggesting maybe you could give some
Sure.
comfort and support.
Yep,
I know that at the daycare center where my granddaughter is, her little hands are being washed so frequently that she actually has she has eczema, so she has other things that happen than the cracks and the peeling and things. So it's a balance of a lot of things.
Sure, that's right. And I certainly can send out that as well, some guidance on influenza as well. So, but I haven't heard anything from providers regarding influenza. So I think it's more of the COVID-19 concerns right now. So.
Okay, Kim, Dave Baker here. Any discussion with the childcare providers, and I'm assuming when you're communicating with the in-home providers as well. Is that correct?
Mm-hmm.
Okay.
Correct.
And any needs that have been identified regarding personal protective equipment, sanitizer, masks, any of that type of concern at this point?
A couple weeks ago, I did get some calls from providers regarding, they were having a difficult time finding bleach. And bleach is something that, that it can be used. It's not the best thing to use, but you can still use that in childcare. But with Clorox being sold out across, if you've kind of been out in the stores, we know that everything's kind of clearing off the shelves. But I have not heard. The providers that I talked to did find what they need. So I have not heard anything more. It seems like when I do talk to them, I do ask them and, make sure that they do look forward and try to order as much as they, not obviously hoarding it, but that they do have enough product available for them, because that is a concern. One of the concerns that, and this is across the state as well, thermometers you can't find a thermometer. One of the things that they obviously are doing now with DHS directives, and that's also in the CDC community mitigation, their guidance as well. So we are, DHS is following that. So it is kind of hard to find thermometers. And I know I've heard from one center, they do have a thermometer, but they would like to have another one in case that one is no longer working. The best thing is probably to have one that just scans where they don't have to touch, a child either. And the one that's axillary or the one that you put under the arm, that takes time, and when children are coming in, they try to do that social distancing. So thermometers are one of the issues. And I know at the state level, they're looking at that. I know CCR&R and DHS are looking at trying to get these supplies out to our daycares across Iowa. So.
Okay. Could you please circle back with them if it's been, a week or two? That's like a lifetime in today's world. Could you circle back with them on your next communication and see if any of those needs have changed, and just keep us in the loop?
For supplies, definitely. Yep. That's what like I said, I wanted to actually call each one of them that I have numbers for. I can also get that list. I know some of the centers here locally have closed. CCR and I would have that, the best data on that. So I will start calling today, and I will gather that information.
Okay, thank you.
Yep.
The thermometer issue has been on social media as well. A lot of chatting about people that have need in the community about thermometers. Tom Berger and I spoke about that yesterday and what access he might have to, they're not necessarily the thermal scanners, but just anything. So I think that's making another request round through our emergency management team as well.
Right. That's great. And like I said, I even went online last night just to see if there was anything out there, and they're pretty much gone. So same with everything else that we're looking for. So, but that was just kind of what I've been hearing from a few of the centers.
Okay. Other questions for Kim? Ann, anything else?
Thank you, Kim.
Thank you.
Thanks, Kim.
And I'll keep you updated. Yep. Thank you.
All right, thanks.
Have a good.
All right. Is Patrice and Tom, are they on? And I can't remember if Patrice wanted to go late because there might be monitoring another call at this time. Can we find out?
I am here. Can you hear me?
Yes, we can hear you, Patrice. I just wasn't sure if you wanted to go now or wait till later in the meeting.
I'll probably go right now and then get into my other meeting, if you don't mind.
Okay, so we have Patrice Lambert, Director of our Dubuque County Health Department.
Okay, and I would just like to start. I know that you all know that we've had Dubuque County resident was the first Iowa COVID death, and we cannot stress enough that, first and foremost, we express our sincere sympathy to the individual family. This death is a tragedy, and it's a reminder for all of us for the seriousness of this virus. However, it is also important that everyone understands that this does not mean that Dubuque County is more at risk for the COVID-19 spread for deaths than any other area. So we just really want to express our sincere sympathy. Dubuque County has not had any new positive cases in the last couple of days. Statewide, there are now 124 positive cases. There's 2,315 negative cases in the state of Iowa. So that's an update with the Iowa numbers. Let's see, Dave, Supervisor Baker, you had asked about our website this morning, and I did reach out to Nathan, and he did give me some numbers, and I just wanted to share. You were wondering if we were indeed reaching the public and the county residents, and Nathan did send out that in the week of February 17th to the 23rd, we had 6,111 hits onto our website, and then this past week that we just had, that had already increased to 12,032 hits. So Nathan did say that that's the total website hits, not just health, but he said it's pretty easy to assume that the 5,000 increase were basically people looking for the COVID-19 information. So I just wanted to share that with you.
Okay,
and then
Patrice,
also,
if I can jump in on that, there was maybe a couple different messages, and as you can tell, I'm kind of an insomniac because I send emails at 3 o'clock in the morning. But I also wanted to make sure, I know that there's a meeting tonight, a special work session with the Dubuque City Council, and I think that's great. And I know you and Tom Berger will be part of that, and that's good. I just want to make sure that the other towns, the mayors, the clerks, and the city councils are being contacted, and if they need, that they know that our team is available. Would probably, of course, have to be by phone or by Zoom these days, but when they have their various council meetings, you know, I say from Asbury to Zwingle, from A to Z, that we should, you know, be making sure that we're in touch with all of our towns. Like I said, I'm pleased that there's going to be a special work session with the Dubuque City Council tonight. We want to make sure that all the other towns are included in the loop.
Sure. And I will also add that Randy Gale is our JIC PIO person, and everything that he releases, it does go to the city clerks and a variety of people in the county as well as the residents of the city of Dubuque. But my office Bailey and Colleen can help me follow up. We can make personal calls to the city clerks just to make certain today that they are getting that information.
Okay, thank you. And I occasionally have to remind people that, you know, when they talk about the county includes all 98,000 residents, including those who live in cities and towns, and it does include the city of Dubuque, obviously, but as I said, Asbury to Zwingle, A to Z.
Absolutely, and please know, I agree 100%. Everything we do, it's for the residents of the county. So I agree.
Thank you.
And I know
Dave,
that
this is Tom Berger.
Oh, I was going to say, I know that Tom Berger will update on the county as well. Do you want to, Tom?
Actually, I have some questions for you, Patrice.
Oh, okay. Should I finish my report first, or is it on the county?
Well, it is about the county, it's about the website, it's about the bleach issue. I want you to follow up with Kim Gonzalez, and the issue about the immigrant community. So I have 3 issues, whether you want to handle them now or come back after Tom gives a report. I guess that's up to you.
Well, I'm not through with my report as of yet. Do you want me to finish my report and then you ask me questions and then Tom?
Sure.
Okay. I'll make it real brief then from here on out.
You don't need to make it brief. Make it complete.
Well, I just wanted to also add that we have been getting numerous calls from people wanting to help us make the homemade mask donations. And we have still been in contact with Iowa Department of Public Health, and they are still not recommending as of yet for homemade masks. So we know that once we get the clearance from IDPH, that we will not have any problem with the residents of the county volunteering to help make those. So that's a good thing. And I know that we have been informed numerous times that there are many, many scams out there. So just be careful with emails and phone calls and everything else coming out. Again, we refer everyone for scam stories, scam supplies. We tell them to go to those valid, trusted, credible sites with the Iowa Department of Public Health and the CDC. Don't assume that because someone with a fancy title is saying this is true. Don't. I mean, go to the credible sites for that. I did talk with Stacy this morning, and Stacy said that her staff, Stacy Killian at the Visiting Nurse Association, they are still checking on their elderly and disabled population that they serve, and they are now doing the shopping online for those individuals. We know that that's the most vulnerable, one of the most vulnerable populations. So Stacy said her staff is helping them with the shopping online, paying online, and then having the delivery to their house or someone picking it up for them and delivering it to them so that they don't have to go out and do their own shopping. Stacy did say that immunizations are still considered through the state of Iowa as an essential service. So they are still continuing with their immunization clinic 1 time a week. They are doing the social distancing. So their appointments are staggered, but Stacy had said so far it's all working. And I did ask her about the call-ins, how many residents had called in for a variety of questions. And Stacy did inform me since March 16th, they've had 427 calls. So we know that those calls are coming throughout the county as well. Let's see, that's probably all for right now. So Ann, what were your questions?
Well, my first question concerns actually a text I just got from someone who's participating but muted, saying that on the bleach issue, the small cities and towns who have water systems stock bleach in great quantities. And so reaching out to those communities would be a source, and I'm sure Tom knows that too. We might have the ability to transfer some of those supplies to daycare if that's an essential need that they are short. So I appreciate that very much from someone who's participating with us here on Zoom. I also wanted to talk a little bit about, and I don't need answers today, but I want you to be working on this as a team, that you have a plan for the immigrant community. There was an incident last evening, and I'm not going into specifics because of privacy, but I want to know that we have not overlooked that and that we have gotten to that population, so that when we have opportunity to take action, we're able to actually, we have thought that through, we have a plan in place, and the hospitals know how we intend for them to execute. That's important to me, so I will ask again on Monday offline what changes you've done and where you are with that. My final question is about our website. And your personal letter on the website, Patrice, continues to list the three things. People know to frickin' wash their hands at this point, pardon me. And I don't know what it's gonna take for our website to include information that we have a strong recommendation to stay home. Whether we cut out Roy Buell's statement, whether we make a statement today, that our website does not reflect this Board of Supervisors' opinion about that. So I would like to know how we can make our website and our information mirror where we are. You appropriately recite the Iowa Department of Public Health things, even though the governor is now encouraging people to stay home. And we don't have that listed for, the what can you do now. I would like to have us be a little more emphatic on our website about direction, and would ask, maybe we're going to talk about that later in this meeting, but I'm concerned that our website, the voice on that continues to be a little bit outdated information in terms of what you can do now.
Sure, and I'll be glad to talk to Nathan and Karen about that. That's no problem. And then also back to your other question, I did talk with Stacy last evening as well as this morning, and she was going to be assigning one of the communicable disease nurses to work with that population. So we will be able to give you an update on that next week, Ann.
Thank you.
Patrice, Dave Baker here. You were talking about Stacy, and I know she's a valued member of the crisis team. Will she be part of the city council meeting work session tonight?
I don't know. I'll check.
Okay, I assume that that they wanted the update from the team, and I know that Stacy is working closely with Mary Rose Corrigan and yourself and Tom Berger and Dr. Canaro and others. So I just wanted to make sure that she was invited. I think she has a interesting perspective door to door with residents, her clients. As you said earlier, they're focusing on their elderly population, and in some cases that might be the only contact in a day for some of those folks.
Absolutely, and I agree 100%. Stacy is valuable, and the whole entire VNA staff as well. And yes, Stacy is part of the Public Health Instant Command management team. So
Great.
Yes.
Okay. And then I had a question, and this was brought to my attention that because even though we don't have a stay-at-home order from the governor yet. We have people that are doing the right thing. I wanted to bring out that we have people that normally are able to socialize. They're doing the right thing. They're staying home. But with that, I think I haven't seen any emphasis placed on mental health, brain health. And I know we have the Iowa helpline. And I talked to May Hinchin yesterday, and I think the region may have another phone number, and you might be able to fill in with me on that or for me. So I just, and I think maybe this goes along with the updating of the website to make sure we have all this information there so people can find it. So I guess either Patrice or Ann can respond.
Sure.
That was a citizens' concerns on our brain health, offerings.
And I did get an email from Peter Supel with the brain health. He's coordinating, here's his email. We're planning to host a brain health conference call later this week or early next week. So we are going to be looking at that very soon. If not at the end of this week, the beginning of next week, Dave, so.
Okay, and I guess I'm also talking about if somebody is in a, if it's possible for us to get more information out there about what's available now. So I guess it would fall under marketing, if that's the right term. Is it easy for somebody who feels like they need services, need help? Is it easy for them to find, the help that they need? That's really, and you're the expert, so I want just a review of the various websites and other means of communication to the public.
So on our website, if you link to the Mental Health and Disability Services page, the helpline comes up with both the crisis line, chat line, and text line. Those function, and there's been a push to move providers to telehealth. That's still in the beginning stages. I'm not sure that there's anything happening here aggressively. We could certainly make contact, and I'm happy to do that with Hillcrest to see, but we could have our mental health disability team. We have 2 employees at the county level who work with mental health and disability services. They could be issuing or writing something that could put greater information on the website about in the times when we're asking people to stay home, what they can do for telehealth and what access there is. I think that's a great task for them to take on.
Okay.
I don't know if Jody is going to be here or joining us today when we go to our directors departments, but Jody Jansen would be then the director of that department for the county.
Okay, thank you.
Thank
Anything
you.
else for Patrice? Any other questions? No. Ann, you have any other questions for Patrice?
Thank you, Patrice. You're doing an awesome job.
Thank you.
Thanks, Patrice.
Working with great people, so thank you very much.
Okay, I think Tom Berger's ready to tee it up here, so Tom, if you want to jump in.
Yeah, first I want to talk about the this morning when you're talking about the small town communities. Just like the conference call we were on, or the Zoom presentation last Friday, we reached out to all the clerks and they share that with their mayors, and a few of them reached out to me since then with issues, and we've resolved them. So this is no different than any other disaster where they know how to get a hold of me and have my numbers. So I think the information is getting out to the clerks. Our plan moving forward is to do the next week, start weekly meetings or more as needed with the clerks and they can invite their elected officials to be on that, so we can give them a briefing from the EOC and what the incident management team has been doing. So I think that's being handled. They know how to get a hold of me pretty easily with just because we've been working together for how many years with regular disasters. So with that, also on the thermometers, I did put a request in for the state for some thermometers this morning. I'm not sure if they'll come in faster that way or through different suppliers. So we do have that need noted, and we're trying to procure that at this point too. With that, we're also forwarding on any information to our EMS teams. We're starting to fulfill supply requests from healthcare. What the IDPH is doing now, or through Homeland Security, they allow us to go out 7 to 10 days, to kind of triage statewide. What they're doing is trying to make sure that the supplies are obviously getting where they need to, as well as the places that are running out. So far we did receive 2 shipments from the state. So we got crews out delivering them to some of the long-term healthcare facilities right now. The EMS will be getting theirs as well. So that's kind of where we're sitting with supplies, but we're doing much better than we were with the N95s through some businesses that donated them, that had them around from the H1N1 crisis. So the good thing about them is they're all still in the package, and they're on the CDC's website as able to be used. So that's kind of where we're at with the supplies at this point. So
Okay, thanks, Tom.
any questions?
Ann or Jay, questions for Tom?
I have a question. I guess it's to Supervisor Wickham as well. Last night, Tom, in picking up the thermometers from you at the over at your office, I saw Jay's plan sitting on your desk and asked you about it, and you had great interest in executing that the structure of the plan that Jay presented to us on just Monday. So I want to make sure that if obviously not duplicating, and you felt that at least from your perspective, it was a smart thing to be looking at. I don't know if the time is now or, or how to coordinate that, but I wanted to be sure that Jay was aware that there's interest at some of the highest levels in executing on that plan. So maybe we want to bring that back up, maybe for Monday's meeting, and kind of flesh that out to see if we're, how we can make that be effective.
Right. My thought on that, Ann, is, and thank you, and Jay and Dave. I kind of look at it like this is a big disaster. Obviously, this is a big emergency. If we get them groups, or even possibly expanding it as we go, I'm sure it's going to be fluid. But just take the businesses, for instance. If we see, if the incident management team gets a request from a business that might be struggling because of the way the economic situation is, or the unemployment, then rather than us having to deal with it, we have that group there that could deal with that and work with them as far as getting them hooked up with the SBA or other state programs that we're not as familiar with on the economic development side. So that's kind of the way I look at it. It's just like after Hurricane Katrina, they went back to the past presidents to do campaigns and stuff. It's kind of the higher level people. They wouldn't be doing the operations or down the day-to-day in the weed stuff that the incident management is kind of coordinated. So I look at it as a help to us and hopefully ease our workload.
So it's, we have this quorum situation where I can't offer my help to you directly, Supervisor Wickham. I don't know if that's something you are going to take action on, or what, or when, or what we can do to help execute that. But certainly the conversation with Tom Berger, and then again, what he's just talked about today, I would encourage us to pursue that. If you want to jump in, or we want to schedule that for Monday for greater exploration or, I don't know, Jay, what you're thinking.
My thoughts are very similar to where they were on Monday. I believe we need more assistance, more resources, and those components that we talk about in the medical, business, and the community areas are the categories I think we need that help. It's going on right now. There are plenty of people doing plenty of good work. What I was hoping that I would get from the Board of Supervisors and also the cities is that the consensus that we want to engage those groups, organize them, and empower them.
And
Monday is too late. We need to do that today.
Right. I believe, Ann, that we can talk about it, establish consensus today, and then, if there's some fine tuning that would need to be done, that can come back to us at a future meeting, or if we need a special meeting to do that. But I think I agree. We should send a message, and I think Supervisor Wickham has done a lot of work on this. So I think it sounds like we may have consensus to move on this and get the wheels turning, and not necessarily wait for another meeting. But if there's anything that needs formal approval, obviously we would have to put that on the agenda, and we'll certainly, with the way things are changing, this may not be our last meeting this week. If we need another meeting, I won't hesitate to call that. But right now, we're scheduled for next Monday at 10 a.m., which, Dawn, please remind me to check with Tom Berger and Patrice about whether 10 is the appropriate time, because they have a conference call at that time. There was some discussion between Patrice and myself about moving that back to 11, because the state conference call or webinar seems to be at 10 o'clock. So that's another thing for us to revisit before we're done here. But so
Dave, that'll be on the Wednesdays. The Wednesdays is the one, so I was trying to be on both right now. So
okay.
Yeah,
Do
Mondays.
we need Tom to stay with us here?
The other one ended AM, so I should be good now.
Okay.
Okay, so Tom, as long as you're live there, Patrice and I had been discussing this. I didn't realize it was just a Wednesday thing, but for the board, does it make a difference if we meet at 10 or 11? Or do we want to do 10 o'clock on Mondays and 11 o'clock on Wednesdays?
Let's plan to meet tomorrow or Friday and then go from there.
Okay. Yeah, we'd have to, for tomorrow, we'd have to get a notice out real quick, which we can do. But I'm thinking maybe Friday, another meeting on Friday with everything that's
sounds good.
Happening.
Pick a time and go.
Most of our physical meetings are canceled, so it's just a matter of getting a time set. So Friday. Ann, do you have a preference on time for Friday?
I do not.
All right, let's.
I'm hoping by Friday I see both of you working at home as well, Zooming in.
I think, Ann, I'll take that under advisement, but there are times where having someone down here is helpful. So I've been told anyway. Okay, let's go ahead and establish our Friday meeting. I would like to stay away from late afternoon is all. I have a Zoom meeting at 3 o'clock, so as long as we're done by 3 o'clock, I would say I'm good. So you want to do
It's call time. I'm available 24/7.
Tom, Berger, and Patrice, would 10 o'clock work on Friday?
This is Patrice, and we do have a conference call at noon. So again, with the instant command, so we can either do it before the conference call, or if you wish to wait, if there would be anything developing that we could share after that conference call with everyone, it makes no difference to me at all. Thank you. And it is only Wednesday, as Tom had mentioned, that we have our state webinar. Sorry.
Okay, so
10 would work good, Dave.
Patrice, I have a question as well. I'm getting a question about who is the liaison for the long-term care community? Who is doing outreach from the VNA directly to long-term care, not just folks who are at home, but also those institutions and nursing homes and such?
Right now, I am, Ann. I'm that contact person, but we're looking
Anytime's
at
fine,
shift,
24/7, I'm available.
but we don't have definite confirmation from that person as of yet. So hopefully by Friday, I can share that with you, that name.
So that's falling under what you're actively doing every day?
Correct. Yep.
Thank you.
Uh-huh.
Patrice, will your noon conference call be done by 1 o'clock? We could do a 1 o'clock meeting, then we'd have the up-to-date report.
Yes, it will. What do you think, Tom?
Yeah, I think you're fine. If it works better in the morning, you can do it right at 10, or, we can go at 1, or.
Let's get going.
Okay, how about 1 o'clock after the conference call? 1 o'clock
Okay.
Friday. All right, let's plan on that.
So board,
Thank
get
you.
your agenda items to me by 12:30 tomorrow.
Okay, and will you make sure that this is on the agenda?
Yep, already.
Okay. We're gonna put the, plan, the Wickham plan on the agenda for Friday at 1 o'clock.
Great.
Okay, any other questions for Tom Berger?
Well, maybe I have a message, if the chair would allow.
Of course.
So while Tom's still on the line, is that, the message that I would have to the group that's assembling and to the public of Dubuque County is threefold. The first is unity. The second is kindness. And the third is to let you know we're working for you. On the unity front, we need all 21 of our local governments to come together along with the county to make sure that we're keeping the public safe and we're planning and acting together. And I've been in communication with many elected officials over the last 3 days requesting that. The second issue is kindness. This is not the time to judge. People are making decisions. They are making them individually. But if we stick together, if we show kindness, we'll be in a better position. And my third, to let everyone on the phone know and everyone on the Zoom meeting and those that receive this through our wonderful media, is that we're working for you. There are members of the medical community, the business community, the community that serves the young, the old, the disabled. They are actively working 24/7 to try to plan, prepare, and get us into a position where we're a more safe community. And I thank all of those in that sector for their help. We'll get through this, but now is the time to be kind, to be unified, and to act. And that act might be just to stay at home. Thank you, Chair.
Thank you, Supervisor Wickham. Ann, any comments or any additional questions for Tom Berger?
No.
Okay, thanks, Tom. And so we'll see you. We'll talk to you Friday at 1 o'clock.
Okay, yeah, I'll try to stay on here as well if anything else comes up.
Super.
Thank you. All right. So that, I believe, is the end of agenda item number 1. We'll go to agenda item number 2, County Operations Response Plan. So we have item A, elected official and department head operational update. So we'll go to Dawn Sherman.
So this is just, I've had a couple reach out to me about participating. If you have an update on how the COVID crisis has affected your operations, I just want to be able to communicate that out. Please raise your hand in Zoom or send a chat. We're just looking at a brief update if any of your operations have changed since we first all met together about a week and a half ago. I'm going to unmute Anthony here. Anthony, are you there?
Yeah, can you hear me?
Yes.
Yes.
Okay, good morning. I just want to give a quick update that as of noon yesterday, we sent all of our maintenance crew home to be on call. You know, they're still responding to emergencies, but in general, they're all going to be more or less shelter in place at home. But we are still monitoring. We're taking in phone calls. We've kind of raised the threshold on what we're responding to. We're not going to respond to the typical pothole, but if we have stop signs down or washouts, those kinds of things, we are going to be out there doing those things. But we have really dialed it back quite a bit.
Okay, and Anthony, Dave Baker, I know we've had this discussion. I support your recommendation. I just wanted to make sure that the public knows that if our staff are needed, they will be available for a call in. They're basically in on-call status, I also I don't think this probably is an issue, but I guess I would ask to make sure that our folks understand that they're not to be out working another side job or anything like that during this time. They're available to report at a moment's notice at your call. Is that correct?
That is correct. I've instructed them to shelter in place basically, but during hours they are expected to be available. During between 7 and 3:30, which is our normal working hours, they are to be available and ready to be called upon if needed.
Okay, thank you. Any
Question
questions for Anthony? Ann?
Yes, I do. Anthony, if you could just maybe clarify some, folks are wondering why we can't begin work on gravel roads. I understand that we are done doing the very mundane kind of inventory control, make work things to keep people, to have stuff for people to do. But we know that there are county roads that need attention. Can you explain what your opinion is about the nature of the workload at this time?
Sure. Yeah, we're in that sort of delicate phase right now with the gravel roads. We're still a little early on what can be done on the gravels. We were placing a little bit of rock here and there, but we can't do any full-on grading of the roads quite yet. They're a little too sensitive to frost in the ground. We've had some recent rains. If we start opening up the roads too much, they're going to turn them pretty muddy fast. So we're cautious over the next week or two. I would say by first or second week of April, with the way this weather's trending, we should be able to really get into the normal blading procedures. But again, the guys are on call and are more isolated, so they may be called upon a little more so than other guys. As roads are getting over the next week or two, we'll call them in as needed. Okay.
But judging the update of the circumstances as well in terms of what other recommendations there are, obviously. And then to my next point is any subcontractors that are performing work for the county. We're encouraging our own employees, our families, our community at large to stay home and shelter in place. Do we have any way? I don't know that we can force subcontractors, but do you have a feel about what subcontractors might be working on right now and how we would allow them to execute judgment for their teams?
For right now, we only have one project going on, and that's over on Black Hills and Lansing Road with Top Grade. With our staff, we're trying to be careful and keep distance from what's going on there. At the same time, still monitoring, for inspection. I have heard that, contractors are taking extra precautions. For instance, River City's quarries, they're not allowing anybody from the outside to get into their loaders, or the scale house. They're trying to keep distance from their they work with. So I think there are some steps being taken out there. So for right now, I don't see the need to suspend contracts. I think there's good practices taking place right now.
Very good. Thank you for your updates.
Okay,
No
any
problem.
questions for Anthony?
No.
And Anthony, per our discussion, you said that some of our lead folks like Chad, Pat, will be out driving, looking at roads, something that they can do safely without being around other people. Is that correct?
That is correct. And as we're taking phone calls in the office, Marianne is still in the office. She is sending work orders out to Chad, Pat, and myself, and we are going to respond to those work orders. So yeah, those guys will be out monitoring things.
Okay, thank you. All right, is there anything else for Anthony?
No.
Okay, thanks, Anthony.
All right, we have County Attorney May.
Okay,
CJ, you should be unmuted.
All right, very good, thank you.
morning,
So
CJ.
good morning, everybody. I sent that email out to all of you on Saturday, kind of telling you where we had gone from Thursday to Friday. So that remains, and just to kind of summarize that, all of the assistant attorneys are working remotely from home on their laptops, and I think they're doing pretty well. There is one here with me, and we'll take one person here every week until, I guess, for the notice. My assistant Heather is here, plus one of the victim witness coordinators, and the other one is coming every other day. And I have one other employee Thursday in the morning for a little bit, just to make sure we have the things all in order and ready to go, because all that stuff goes to Cody and what after that. So there's a lot of moving parts, in the court system here. The judges are doing the best that they can to keep things moving along. We continue to see people that have been arrested, the night before, somewhere between yesterday and the morning, and this morning, for instance, in video court. So that's gone pretty well. Those numbers are kind of down. They were kind of still normal towards the end of last week. I think Saturday when I was here, we had like 9, and then there was like 4 Sunday. There was about 4 today, and there was about 9 yesterday. So that'll probably just go like that. We, as I mentioned, are taking a clear line of releasing anybody that's been arrested on the minimal terms, most likely just a signature bond or no bond at all, so that they can be released from the jail. We'll continue to work on that. We've been working with the jailer on folks that are awaiting sentencing. So we're trying to get that moved. That's dependent upon getting reports from the Department of Corrections. So we're the best we can with all of that. But so far, it's gone pretty well, I think. I saw you yesterday, Wickham. I was answering the phone, so the main line out there. So in the afternoons, it's kind of down to just myself and the other lawyer. So we're keeping it going here, and I talk to Sheriff Kennedy rather regularly, probably every day, but almost, I'd say, and we try to keep on top of things that our 2 departments are working on, and also with the city police department. So that's kind of where we're at for right now. I guess we'll just continue to do this until something else changes.
Okay, any questions for County Attorney May?
No.
Ann?
No.
Okay, thank you, CJ. Thanks for the update.
I believe this is Sheriff Kennedy. I'm unmuting. Sheriff, are you there?
Yeah, can you hear me?
Yes.
Okay, Joe.
Morning.
Good
Morning.
Just a heads up, I'm not sure what's going on, but I can barely hear you guys. Anyway, so we went a little bit farther than what we had before. We closed the inner lobby to the law center. The Dubuque Police Department and the Sheriff's Office both closed down their walk-in window. So I think they have a couple staff people working in the office, but they've reduced staff on their side. We've gone to an A and B shift on our side for the clerks. We have them coming in, basically working until they are caught up with their duties, and then we're releasing them for the day. As for the jail, we still have visitation opened up, but we've been discussing whether or not we can make other arrangements for that. It may be closing down in the future within the next few days, but we haven't come to that decision yet. We were provided some masks by the EOC, Tom Berger, and so our deputies that are working directly with the inmates are all wearing masks now. They're not N95 masks. We understand that they are not the desired product. However, our biggest concern is making sure that that our employees aren't the ones that cause an outbreak of the illness up in the jail. So that's why we have our employees wearing the masks, hopefully to catch as much stuff as we can and keep the inmates from getting sick. Because in that confined environment, I think this would probably go around like wildfire. So yeah, those are our updates. I guess, does anybody have any questions on that?
Any questions?
I would have a
Sheriff
question.
Kennedy?
I have a question about the level of precautions that you're taking, both with new inmates. I know we don't get discretion about who we get, but are you doing any kind of an initial health check, temperature scan, as we take new people in? I don't know if you can assure us that you have a plan in place for the contingencies if it spreads through like wildfire. Do we have medical staff? I mean, do we have a plan to execute? Can you update if everyone is appears to be virus free at this point? Anything like that you can just give us a general update about?
To this point, everyone appears to be virus free. Right now, we do have one inmate in infectious disease protocol. He is not showing symptoms. He was an inmate that was transported up here from Texas. Because he came from Texas, we just put him straight into the infectious disease protocol. He's in the segregation unit by himself. That unit, our segregation units ventilate directly to the outside. So there's no risk, or there's a very, very minimal risk that he would be able to infect another inmate where he's at right now. We're going to have him in that protocol for 14 days. And then once 14 days is up, then we'll give him one more check and we'll release him to general population. We are, with all new inmates, they are all going through a infectious disease protocol where we have a questionnaire for them, and we are checking their temperatures before they go into the housing units. So far, that hasn't been an issue for us. And then as far, then your other question was, what plans do we have in place? Is that correct?
Right. Basically, to say, if you said it would go through like wildfire, have we developed some kind of disaster strategy for that?
Yeah. So what our plan is, we have the segregation units, which can house 10 people. If that got overwhelmed, we would then open up one of our cell blocks just as basically an infirmary for ill inmates, and that I mean, depending on which house unit we had, they would hold anywhere from 24 to 49 inmates. But yeah, we have a plan in place for what we want to do with the inmates. Now, if obviously if they start to show significant symptoms and have to be hospitalized, then we will do what we need to do to make sure that
Sure.
they get the health care they need.
Joe, how many inmates do you have today? What's the census?
I don't know the exact count. We've kind of been sitting around 150 for the last few days. We, as County Attorney May said, we are trying to work with the County Attorney's Office, the defense attorneys, and the judges to reduce our numbers as much as possible right now. You know, we actually kind of see this as a golden time for us to take the opportunity where everybody's not busy with jury trials and other things, where we can kind of get to some of these inmates that are sitting here on probation violations and some smaller things, and hopefully get some of these people cleared out of here and get some of these smaller cases cleared up. Is kind of what our hope is. So, you know, but as of right now, I mean, you know, it seems like as we release more people, you know, more people just kind of keep coming in, and you know, and unfortunately, some of these people are coming in, and we just can't release them back out on the streets. So.
My last question is about the courthouse security. If we have, I don't know if Shane is going to present any update there, but I'm wondering how it's going. How are any ideas about numbers of individuals? Is it generally going well when the public's being stopped at the door? Do you know anything about that, Joe?
I don't know anything specifically about that. I know Shane has been talking to Chief Deputy Reniker, and so I'm not sure if he's on or if he's listening to the call right now.
Is Shane on?
I believe I
Is
just
Dave on?
muted him. Yep, Shane, are you there? He is unmuted.
Sheriff Kennedy, I believe, Deputy Bakken.
Can I just interrupt for a minute? We have a note from Shane saying he's there, but his computer does not have a mic. Everything has been going well to date. I can stop up to the boardroom if we want an update. I think the fact that it's all been
The only question I would have, Supervisor McDonough, if you can relay information, is what's our census through the doors at the courthouse each day? What's that number, that tally, since we went to the restricted access? Average, including employees.
if he heard that, he may even be giving me an answer without me trying to find him here.
Is he in the building?
Yeah. Am I still unmuted?
Yes,
I can hear you. Joe, I can hear you.
Okay. Chief Deputy Reniker just stuck his head in and said that right now we still have 3 people working at courthouse security, but we're reassessing that this afternoon. We may be going down to 2 people working after this afternoon on that. Also, Captain Menster is following. Also, he advised as of right now we have 149 inmates in the jail, and the juvenile area is also open for overflow of 6 individuals.
I have a message from Shane. We have about 10 to 15 people stopping in daily that we need to allow in.
Okay, he's in the house.
And
here.
he's there.
So we'll have to have you go to a mic, Shane. So if Sheriff Kennedy, if you want to hang on, we'll have Shane Backenstead give the courthouse security report.
As it has, they're continuing out what they can, handling by phone what they can. but we do have those emergency hearings yet. We have several, the in-custody inmates, we're still having to allow attorneys in so that they can view the video system. Like I said, we're averaging maybe 10 people a day coming in the building that we have to, but it's a day by day. I don't know.
What's the employee count? So I'm
I
trying to
would
get the
have to
total count of people, because whether they're employee, whether they're an inmate or a lawyer, they
They're
have the
actually
ability to have
going back
COVID-19.
Most of the departments that I'm aware are trying to isolate themselves as well, but I know they're running on.
If you had to
minimal.
estimate, is it
I think
100
they're all
or is it
cutting
close
in
to
half.
25? If you had to estimate how many people are in the courthouse right now, what would your estimate be?
I don't know what a normal number is, but I would say probably 60.
100.
Is it
Usually
over
it's
100 now?
It's over 100 fully at full staff.
That's why I would say 50 to 60. I think a lot of the departments are running a third to a half.
Okay.
I can't say for sure because I'm trying to avoid going into the departments as well and handle things by phone.
I would think, I'd estimate a little bit lower than that, knowing that some of the departments are going in multiple teams.
Yeah, and it sounds like some of them I wasn't aware, maybe.
30 to
it's
50 on a day that are here,
Yes.
coming
think
in and
that's-
out. Okay, thank you.
I guess my question would be how many folks generally, I mean, other than the court system, which could run in some respect by itself, if we were trying to put more employees home or closing other divisions, just trying to be proactive and look down the road a bit, how many folks that might be that are not related to the court system in terms of public entrance. How many people might be coming to the recorder's office?
I guess I didn't hear the question. How many are coming in that are not related to the courts?
Yes, how many might come to the recorder?
We haven't had anybody. So far we are isolating. All the department heads are doing a great job. If someone calls, they believe they have some type of emergent situation, our security is just directing them to call the department. They are speaking with them directly, and if it is something that they need to facilitate, the department head or someone from their office is actually meeting them out in the little lobby area so as to not bring them in the building and make their staff, I guess, susceptible to that person as well. I would say we're probably getting 15 to 20 of those incidents a day, where department heads or someone from an office is coming downstairs, whether that be something from a courier, paperwork that's needed, handing something off. We're trying to stay out of that as much as possible so the departments can handle their business and make that determination. I would say we are probably still getting throughout each day 50 to 60 people that are still coming into that front vestibule looking for paperwork, making phone calls, trying to get into the building, but are being addressed to contact whatever, 50 to 60. And a lot of those are still court appearances, but there's paperwork down there as well. I think the large majority are starting to realize things are shut down and they're just calling. But we're still getting an influx of people that come in and have questions.
Okay, thank you.
Shane, would you?
I know we have Judge.
Go ahead, Ann.
We had Judge Lecker on the call here. She's been following us. I see that she's present. Maybe if there's an update from the courts, if they know if there's been any change. Maybe you were going to ask them that, Dawn, if they have an update as well about any changes. It's not technically a department, but we house them in the courthouse, and I don't like 50 to 60 people numbers coming in with public interaction. We would like to see that be reduced.
I do have, Judge Shubat emailed me. I need to look at, I do have a question though that may pertain to Deputy Bakken. Said somebody on Zoom is asking if we have, as temperature scanning process begun?
We doing any temperature?
Scanning?
We are not doing anything with any employees that have access to the back building. We are just at the front, and we are asking those questions of anyone that may possibly come in.
But you're not doing any temperatures?
We are not doing, I do believe Chris is for anyone that he is coming in that is working in the building.
Okay.
But if it is something we are allowing in, we are not at this point. We are asking if they have a fever, if they've traveled, if they have a cough. If someone is exhibiting those symptoms, we're not going to allow them in.
Okay, thank you.
Not finding Judge Shubat's email, but it was, nothing has changed since they had spoken the previous Monday.
I have a note from
Kellyanne Lecar. Can you hear me?
There you go. Yes, I hear you,
Yes,
Kelly.
we can hear you, Judge Lecar.
Okay. Yeah, we are working every day to reduce our hearings. I'm certain that there will be people who continue to come for the next several days, probably into next week, who may think they have hearings. You know, we're getting those processed and sent out as soon as we can. Some people don't have email, they have to go by paper mail. But we are making every effort to alert all of our judicial branch consumers that hearings are being converted to telephone or are being continued. So you should see that number from us continue to reduce as we move things off of our calendar. We don't have any new updates. Judicial Council continues to meet pretty much every day at noon. We have not had any big moves by the Supreme Court recently in terms of changing how we're doing business. We've got some contingency plans in place in the event that we go down to even something less than the services we're providing now. But as of right now, we're holding on our drastically reduced services and continuing to get the word out that we're doing nearly everything by telephone. But of course, you're still going to have those people come in who need to file, for a mental health commitment or a substance abuse commitment, or who may have an emergency juvenile court hearing. We are still going to always have some small amount of people who need to access the courthouse from time to time.
Okay, any questions?
Is there any
for Judge
discussion, Judge LaCar, is there any discussion about if the governor should move to a shelter in place, you would reconvene then as a judicial commission? Is there any discussion about that generally?
We have just, again, had those basic discussions about what will we do if the restrictions get greater. And really that would take a few of the things that we're still doing off of our schedule, primarily because it would limit our judicial officers' availability in some instances to do those that we're presently doing by phone, plus we wouldn't want the other people who are involved to do those by phone. But again, we're still going to need to be able to provide those essential critical services to citizens who are in need of judicial branch services. So not much is going to change, honestly, for us, if even if we do go to a shelter-in-place situation because of the need to provide the critical services.
Thank you.
Okay, I have a question then for Supervisors McDonough and Wickham. We have Shane Bockenstead here. It sounds like we're looking for data, for information. Would we like Shane to get with maybe Chris Soder and give us a report Friday on traffic? And I don't know how difficult that is, Shane, including the back door.
We have a few elected officials on the line here that are working at the courthouse. So if you feel we can make a decision or we can make a direction today, we don't have to wait till Friday and have those additional people walking through. So sounds like the premise is that we need to be open for emergency courts. We always knew that, and Judge LaCar just confirmed that. But the rest of the county functions could be suspended. And so are we at that point? So that would be a question to elected officials on the phone and to my colleagues.
Right. I know that the governor sent out a letter, I think late last week, asking the courthouses to not even be perhaps as far along as we are. She wanted them to remain open. So I think I'd like to see an update on Friday. I think we should be working to bring those numbers down. It sounds like the public is falling off. It sounds like the court system is falling off and working to reduce their numbers. I saw Auditor Dolan shaking her head no in terms of whether we're willing to reduce or ready to further reduce or close the courthouse. So I think we're all trying to, I don't know that, we cannot close it more than we have without a few more people to weigh in. It's still my point on that.
City Hall did close this morning, so I don't know if you saw that email.
Right, they had an employee. It's closed temporarily. They had an employee with suspicion, and they needed time to do a deep clean. So that isn't as if they closed. They intend to reopen, as far as I understand.
Okay, so we'll just wait till we have our first case.
I'm working with all the elected officials and all the decision makers. We're not the only people in the courthouse.
Can I make a suggestion?
Sure.
Sheriff Kennedy, you have a suggestion?
Yeah. If you're concerned about how many people or you want to know a number, as long as everybody's swiping in the back door, you should be able to easily come up with the exact number of people in the building at a given time.
I was just gonna say the same. We aren't monitoring the back door, we're monitoring that front door and dealing with the public coming in, but all of those would be accessible, if they're using their card coming in and out. I don't know how many times people are coming in and out. If they're going to lunch, then coming back from lunch. Someone's going somewhere once they leave the building and then come back in, but all that would be accessible through a report that IT would have.
Okay, so I mentioned Chris Soder, maybe I should have said Nathan Gilmore. And if we could get that for our Friday meeting, it sounds like, we're looking for data and hoping that those numbers are declining. Supervisor Wickham wants to know if we're ready to lock up the courthouse in discussions with some of the staff next door here in the auditor's office. Paula doesn't believe that she can do her job at home. We don't know what the policy would be on checks, for example, leaving the courthouse, that type of thing. So there are issues we need to talk to County Auditor Dolan about, if she's available. Okay.
Denise, are you
She's
there?
she's here and unmuted, so she's ready to go.
I am here. I am here. My office is working with a skeleton crew. I have 2 staff upstairs in mapping. They are alternating their days so that if someone would come down and need something, we still have plats that need to be signed, et cetera. So we are trying to facilitate constituents who are trying to get things done. As far as the finance side, and I think you are all aware that Mary is sheltering at home. Roseanne and Megan have been alternating their days in. Paula has been in the office to process claims. There's been no change in the way we process claims. We still need to have hard copy original invoices. It's fine with me if people want to, departments outside of the courthouse want to drop things off in the box out and back of the courthouse. That's fine. But I believe as an essential service, I think government is an essential service. And I think anything we can do to try and keep commerce going by paying claims and that as efficiently as possible, we should continue to do. There's been a lot of money approved for contributions to groups, et cetera. I'm unwilling to change our processes and not have an auditable trail of what we have spent money on during this time frame. Now, the Board of Supervisors, and we've not had this discussion in a year or so. The board is aware that we do a list, which is a compilation of ongoing phone bills, electric bills, those kind of things that are day-to-day operations. And also invoices of below a certain dollar amount. Paula puts them on a list and provides those to you for board member signature. And then she presents to you anything that does not fit the onto the anything that isn't on the list, and you individually sign those claims. Now, we could change procedure and have all claims, Paula input all claims, no matter the size, and present you with a list on, say, Wednesday nights. Whether you come in on Wednesday afternoon or come down on Wednesday night when no one is in the building to be able to sign one list so that Paula can then process the claims on Thursday. We can make that change to the process.
I would support that.
Denise, what's the advantage to that in terms of reduced employees in the building? Are you trying to be more efficient with stay home, or are we looking at supervisor convenience? Where are we on that?
More or less, I guess, supervisor convenience, less handling of paperwork. Paula doesn't have to worry about you guys having gone through all of the claims and signing them. She can then just give you a set of papers that show all of the claims that she's paying, the grand dollar amount, and then you would just sign it. And so she's dealing with less paperwork. I mean, Paula's position is one that cannot be done outside the courthouse.
I would follow your recommendation on that.
Okay, I will talk to Paula and we will have that process started next week. It is my understanding, Dawn, I don't know, we spoke last week, I don't know if this is still going on, that possibly someone from maintenance would stop at the West Campus on a daily basis to bring anything down to the courthouse that needed to be brought down. Is that still happening?
So they're just notifying us. I was out there this morning, and so I just brought back what they needed. So just as they notify us, instead of going in and out if it's unnecessary.
And
Okay.
Denise, I've let the department heads know that if they have mail or documents that need to get to the courthouse, I can swing by there on my way down here and pick those up. I've done that
Okay.
in the last week or so.
So I don't see any problems with continuing to process claims and getting that to, keep that process going, which is probably the only process we have on a weekly basis that needs to happen. I do have staff in the election. They have been alternating as of right now, although I do have, I have 2 hourly employees who cannot work from home, partially because we cannot access the state's voter registration system on anything other than a county computer that is in the office. Doing to process voter registration forms, et cetera. I will make people aware that 5 o'clock today is the filing deadline for primary election ballot. And so those ballots will be finalized as of 5 o'clock tonight. So we don't know. I mean, obviously our phone number is down at the front at security if any candidate comes in and needs to file their paperwork, and Jenny are in to be able to facilitate that. I believe Jenny spoke with you last week about additional money, which we appreciate that you have appropriated for us to be able to send a mailing to each currently registered voter in Dubuque County with an absentee ballot request form. And we will be trying to do as much of the voting for the primary by mail as possible. And that mailing the proof has been sent to the printer. We're just waiting for word from them as to when they'll have it processed and in the mail.
Denise, we have been in email or texting. I'm texting and emailing with Paula. So hopefully she feels supported that we are responding to her requests for claims, and also with Mary to make sure that we're getting the signatures that we need, even though I'm obviously participating on the internet. But so I'm hoping the staff feel we're responsive. Certainly my point, and I doubt my colleagues is either, is to make the auditor's office less efficient. I think that there's obviously systems interruptions that are understandable.
Right.
I'm gonna, Denise, I have been down here almost daily, maintaining spacing, but being available for your staff. I think, they're doing a great job under very tough circumstances. I don't plan on changing what I'm doing, being available, unless the governor says I need to do something different. But how my counterparts want to do their end of it, I'm okay with. But at this point, I'm planning on continuing to be available.
Thank you. I appreciate that. I will discuss with Paula, and she can just contact you next week, and we'll figure out a new process for when that total list would be available for you to sign.
I do have a question, Denise, and we'll do that. I'll do it in public. If I sign claims, would I be allowed to drop them off at either with outside the courthouse with Supervisor Wickham or McDonough? Or do they need to stay in the building?
Maybe we can deal with that next week.
Well, I think
I can come in. That isn't a problem.
Dave, I think that's a moot point. That's a moot point because we're not going to be. You will not be
Sheriff
signing
Kennedy.
claims anymore. You will be signing.
Hi, Sheriff. This is Don Phillips at the Iowa Ag News.
Hi, how you
Mute
doing?
Joe Kennedy, please.
Really good. How about yourself, sir?
Somebody mute Joe.
Okay.
I think we're good. We got a week.
Okay.
Let's move.
Anything else, Denise?
No, in fact, I need to get off. I have an 11:30 conference call with the Secretary of State's office regarding the primary, so
Okay.
I'm going to get off here.
Thank you.
Thank
Denise.
you.
Thank you, Denise.
Thank you.
You well. Okay, we still have Sheriff Kennedy. I think we were pretty well done with Sheriff Kennedy. And did we decide if we want to report from Deputy Backenstead for Friday for the traffic in and out the back door?
IT is working on getting the reports out of the, from the rear door. It's
Okay.
from that computer system.
All right.
I will work with my guys too to try and get some documentation on how many people actually coming in front door, how many were actually department heads or someone are meeting with at the door, so we can kind of have some numbers for the next couple days.
Thank you, Shane.
You want to wait 60 hours? Is that what we're planning?
Well, I just didn't want to put him on the spot and have him winging the numbers here. So.
I think that's fine. I mean, I think whether it's 30 or 50, it's not good for what we need to be doing, in my opinion. So I'll defer to my colleagues. If we continue to push off decisions, I've been a voice for more decisive action, but I need one more person to act. And I think we can act today. I think we have some of the information. Obviously, we know the court system is going to be in place. We know we'll have security for those. And so the building won't be dark, okay? But I think the message maybe to the public and the message to employees might be different than it was, I forget what day we made this decision, whether it was Monday or last Friday. But I would advise my colleagues not to wait another 60 hours to make the decision.
Jay, I honestly don't feel indecisive. I feel deliberate. And so though I am not maybe where you are, that doesn't mean I lack the ability or in any way am indecisive. So, how we get to this, I think that Auditor Dolan, with 30 some years of experience, said it well. Government is an essential service, and our elected officials know that as well. They ran for this office. The office that they hold, knowing it's an essential service. So, we will get to where we are. I think we could use our time in your concept of unity to look at building consensus to perhaps be reaching out to the governor to encourage her to take stronger statewide action, encourage our own emergency team to use stronger language to tell citizens that it's in everyone's best interest that they stay home. So I think that conversation, we can have that today. It doesn't need to be stuck in the middle of department reports, but I don't feel that that I'm lacking decisiveness.
Okay.
And my feeling is, I believe the functions in the auditor's office are just as important as what's going on second or third floor with the court system. And unless I hear from our vastly experienced county auditor
He might no one has experience with a pandemic, okay?
I understand.
So I know the auditor is wonderful in what her role is. We're not talking about that. I'm talking about community spread, I'm talking about keeping the public healthy and the risk reward of something in the treasurer or auditor's office not being filed.
Okay,
So that's fine. If you, I mean, it's not fine. It's not where I'm at. I think we should move to a further restriction of the courthouse. I think that would keep our public safe. And I would ask my colleagues to do that today, not wait till Friday. Every day we wait, we have more community spread.
I'm not prepared to make that move today.
I don't hear anybody talking about any other strong steps that we know we can take steps about to be communicative with the governor's office. Yeah, I placed a call again this morning.
This is
So,
it's about
you
our
know,
courthouse, not the governor. So it's about our courthouse. So I'm
it
not
all,
confusing the situation.
right,
with the
but we
governor.
are
It's
at the
another
point.
issue. But that's fine. If you're
We are at the point where
there at
there's
the courthouse, that's fine. That's fine. I understand. I understand how our government works, and so I stand down. I stand down, and we will address it on Friday.
I think we are the holders of information that the governor may not have, because we are so much more connected to the community than she could possibly be. So passing on our opinions, the consensus that we feel citizens are coming to, I think there's been a real change in the community over this past few days. And certainly the first death in the state occurring here, Wisconsin closing, there is significant push in this community to make change. And we need to communicate that to the governor. That is to her advantage and our advantage. So there's things we can do. I'm doing that, I think, by myself at this point. I'm not intending to speak for the board, but to try to communicate that at the highest level to encourage her to take a choice that I know is a consideration she's having. And that would be a shelter in place.
Yeah. And I appreciate that, and I think that's wise, and I think that's what our role is, to communicate that to the governor, and so I have done that and have been doing that since Sunday morning, each and every day, and so the governor has not changed their position. I am asking for unity throughout Dubuque County in all the cities we have, all 21, along with the county, and obviously the EMS group, to consider a shelter in place. I think that's what we need to do, but we need to do it in a unified fashion, and I think we're at that point. And so the Dubuque City Council will be meeting tonight, and hopefully they'll be in a similar position and make sure that they can understand what the scenarios are and take that action. That's where I'm at, but I want it to be a unified action. And so I am meeting with other local officials, both in the private sector and the public sector, to see if we can get that unified voice. But I believe today is the day that we should do it. Well, let me phrase that. Monday, if not Sunday, was the day we should have done it.
Okay. We have any other elected official, department head operational updates?
I'm going to unmute Chris Kirsch. She had written on Zoom, but we also have quite a few dozen people on live streaming. So for her, Chris, are you there?
I am. Can you hear me?
Yes.
Good morning, Chris.
All right. So I'll give you a brief update and then I'll open it up for questions. So our current census at Sunnycrest Manor is 100. We have restricted visitors since the 12th of March. Practitioners and hospice are allowed to give care to our residents. We have been screening staff since the 12th of March. Non-essential physician appointments have all been rescheduled, or we have been using telemedicine. Acute situations are, of course, being addressed. We have become very creative with our communication with families, using FaceTime and Google something. I don't know what that one is.
I'm waiting for you to make a dance video.
Yeah. we have had families come outside of our family parlor, and we have residents sitting inside. Much of what you see on the national news, we do that in our family parlor. We have limited traffic in our neighborhood, so dietary sends the carts up, and then the CNAs receive the carts. That's the same thing we're doing with linen and laundry. Linens are sent up on the carts, and CNAs receive them. The motorhomes were delivered last week. Thank you so much to Hawkeye Boat Sales. I'll give them a shout out for running us 2 huge motorhomes. We have them in our shop, so they're safe from outside forces. Staff will start to use them this weekend. That will just limit staff from coming and going. We've provided a lot of education to our staff about when you leave work, go home, have somebody else do your shopping for you. Ask your neighbor if you don't have anybody in your household to do your shopping. Limit contact with those people from the outside world. So we are well here. We have 2 residents right now with influenza B, but otherwise we are well here, and we want to stay well.
Chris, on a personal note, your team posted some beautiful photos of residents saying they are well and they are fine to family. And that brought great comfort to my 84-year-old dad, who has a friend there, that he was able to actually see that person and know that they were well. So it's beyond just necessarily families, but letting the community at large know that people seem to be feeling comfortable. And there is a very large community of Dubuquers and Luxembourgers and folks who are waiting to be asked to do something for you. We are making fabric masks like nobody's business. If you need those, please say. There are other folks who would be happy to be called upon to do something to be helpful if you have a need.
Thank you.
Okay, do we have any questions for Chris? Okay, thanks, Chris, for the great report.
I have the county recorder who'd like to give a brief update.
Okay.
Gotta find him to unmute him. Or did he?
Am I on?
Oh, yep, he unmuted himself. There you go. Yes.
Okay. The 3 things that I just wanted to touch base on quick is I am doing what I indicated a couple weeks ago as far as staffing, setting up into 2 teams and rotating daily, so that in the event that one of us are exposed, whenever that would occur, that we have some people that can essentially come in and continue to operate the office. The letter that Supervisor McDonough referenced from the governor, I think that was primarily focused at recorders as a whole statewide. It was about allowing abstractors in to see the land records so that they can issue their title guarantee and their title insurance. They need to physically see those records. We are in a unique position that almost all of our records are currently online, so they can do that from the comfort of their own office without coming in. And then we are doing some searches for the abstract companies for vital records. We're doing that free of charge for the abstractors so that they do not need to come to the courthouse. So, I mean, I don't think we are quite as impacted by that letter that the governor sent out over the weekend as some other courthouses, if that was of a concern. But the one other thought that I had as I sat here and listened in is, I don't know if maybe Dr. Canero or, maybe it's, folks from public health, would it be appropriate to send them to do to provide us guidance, whether, maybe my office isn't the one that I'm really thinking of right now, as we don't have hardly any public coming in, but looking at our operation at the courthouse, A, but B, more importantly, is maybe to run and give a quick check at Sunnycrest, maybe give them some ideas on what they could do to further reduce the risk of transmission with their residents and their staff, but then also going to our jail and doing the same thing, doing kind of a risk audit of this whole situation and identify ways maybe that we can do this a little bit better if there are options for that.
Okay, any questions for Recorder Murphy? Thank you, John.
I have Jody Jansen.
Thank you.
Okay, Jody Jansen will be up next.
Jody, are you there?
I am there. Here. Can you hear me?
Yes, go ahead.
Jody, good morning.
Okay, I have an update from the region. The region is receiving crisis services update from the crisis services providers. As you can imagine, at this time, they are using either telehealth and or phone services only. The other providers are increasing their use of telehealth as well. The hours for the warm line have increased from 2 until 10 p.m. And we have already sent in a request to Karen to update that on the Dubuque County website, MHDS site. IME, which is Iowa Medicaid Enterprise, they have relaxed the requirement for face-to-face contacts with such services as supported community services. And so the CEO of the region has sent us all a message saying that that will be relaxed within the region too for those folks that the region are responsible for funding of that service. The region is working on placing more links on the ECR website, such as the Iowa Department of Public Health. And lastly, I would like to say that the region, the 9-county region management team and support staff are working fantastically. The CEO, May, is in daily contact with us all a variety of times. Any questions?
Questions for Jody?
We do get it. We do get a weekly update from May, Jody, as the members of the governing board. That's quite detailed, and sometimes it happens a couple times a week. So she reports is the same as you, that everyone's working together very well and trying to make accommodations and be creative in how we're going to deliver services. Thank you to your team.
Thank you.
Jody, Dave Baker, just earlier, I'm not sure if you were on and you heard the discussion, but I just wanted to make sure that we were emphasizing the things like the Iowa Helpline and any other telephonic or online help that might be available for people in a with brain health issues that would need to be addressed, and that may be maybe expanding during this pandemic. So I don't know if you feel like the Iowa Helpline is sufficiently out there, if there's other steps we can take to promote that and let people know what resources are available.
Well, fortunately, the region has had several years to promote those services. There's been a great deal of marketing items out there. Again, it is on our website. It is on the county website.
Okay, I was more talking about the need seems to have intensified over the last few weeks, and I understand that the rollout was great sometimes things get a little dust on them as they sit on the shelf, and people might need a little reminder.
What about moving it on the website, Dave? Let's make maybe Code Red. I've had a mayor ask me if we could take Code Red off for the time and use that space on the website maybe for something different. Maybe we could move the mental health crisis line and the warm line information onto the front page of our home space on the website, something like that. I mean, I'm not micromanaging, for God's sakes, websites, but that might be something we could do. And Jody, if you would just see what Johnson and Lynn County are doing in terms of supervisors pushing out information to be, more proactive about crisis lines and the ability of telehealth. Could you give us a report back on that?
Oh, of course, certainly. And we will work with IT to get that information moved.
Okay, we just got a message from May Hinchin that that can easily be moved. And so somebody with more talent than me in IT will have to work on that. Thank you. Thanks,
Nathan just
Jody.
took a big old swig of beer.
Thank you.
All right.
Thanks, Jody.
We'll continue on with our elected official and department head operational update. Looks like we're through that. Okay.
Yeah, I'd like an update. I would like an update from IT. I would like to hear if Nathan has the ability to give us an update. I had some questions for him yesterday and he responded this morning, but if you could just let us know the status of some details about equipment coming and any changes in your procedures.
And I think that goes into our 2B as well, because he was going to provide a report. So I'll turn it over to him.
Okay.
Good morning.
Nathan on? Okay, Nathan.
Oh, I'm here. Good morning, everyone. So, Cliff Notes version of where IT is currently. Friday, 5 o'clock last week, myself and the rest of the staff, we are working completely remotely. It's been a learning process for IT as well as the users. I feel that it's going well. We are managing the requests as they come in. We are working with the users using all sorts of tools to get things done. Lots of different ways to help you remotely, and it's going well. Jabari, the county intern for my department, he is still physically coming into the old jail for a few hours today. Every day he'll come in for a few hours. Logistically, it's to accept deliveries, organize equipment, put together additional teleworking kits. A few times we will have him drop things off at someone's desk, but he is under strict orders to avoid all contact, and only in a very last ditch effort would we have him work with a user. But that's not, I mean, I don't know what that looks like, but it would be an extreme example. Ourselves, if there is an outage, if there is a down situation, then of course we would come in, deal with it, avoid all staff and avoid ourselves. Fortunately, we can do a very large percentage of that monitoring.
I'm trying to social distance for myself, but it's not working.
I don't know who that, somebody jumped in. Anyway, so we are mailing equipment directly to users where it makes sense. I've got USPS priority boxes at the old jail, so we can continue to mail things from that direction. As of right now, we are out of laptops. We gave out the last one yesterday. I have more coming in today. I have more coming in on Friday. Equipment-wise, to try to give a perspective, there is nothing out there. I've been purchasing equipment for about 4 weeks now. We have, assuming the laptops come in, which I have tracking numbers, they should, we can continue that process of making government mobile. The bottleneck up until yesterday was headsets, but we did get more of those in, so we can continue moving those out. From a remote working standpoint, to my knowledge, we don't have anything that we have not been able to accommodate. There was one challenge with elections, and we solved it, but there's guidance from Secretary of State that they don't want them to do what they want to do remotely. So we'll continue to revisit that with Jenny. Past that, we are plugging away. We're here helping users as best we can. The users have been fantastic. I've said in the past, we have great public servants at Dubuque County. They have been helpful in adjusting their expectations as we have continued to modify in this new reality.
Okay, Nathan, I had a question. This is Dave Baker. You probably already know that.
Mm-hmm.
But, the other day we had a discussion about needing additional funds, and I really thought I would see some kind of a report today. Now, we are meeting again Friday at 1 o'clock. You probably have heard that, but so I want to have an idea what what we're spending the money on, what's been spent, what's needed going forward. And I was hoping to have that today, and I don't know if that's going to be part of your report today, if you have a document prepared for us. And I guess I'll ask my counterparts, because there was a request for additional funding, and I'm willing to do that. I just want to have an idea. I think I use the term to see if there's a light at the end of the tunnel for gearing people up for working remotely, and get some figures that we can look at.
Mm-hmm. Certainly. I apologize on that. I thought you had the document. Stella, I have been working directly with Stella. So
can anybody hear me?
Yes, Stella, I hear you.
I will email it right now to the board. I apologize. I thought I sent it out too. It was in my in my waiting to be sent folder apparently.
So then we will have it then for Friday to put out and let folks see as well, and the community awareness, so we can have discussion and maybe take action on Friday.
I mean, I'm comfortable however the board wishes to move. I'm certainly not going to run out of funding by Friday. If the board wants to wait till Friday, that's fine. If you want to move now, that's fine. Again, whatever you board wishes to do.
Maybe I can jump in as well. The funding request that I had made on Monday was not just for IT expenditures. That is a piece of the funding, but it's also for the entire county-wide operations. And so when we allocated $250,000 for county-wide operations, what I was saying was that the majority of that has been already used up by IT. And so we want to have funding available for others as they need it, for things like if some department gets, if somebody gets sick in a department and we need temporary staffing, or if we need certain, any kind of equipment, we need to be ready to act, because IT has consumed up most of that already, as we kind of expected might happen. So the request was specific to Nathan, and it wasn't Nathan making that request, I guess I should say.
Okay, Stella, I thought a lot of the discussion was that the money that's been spent at this point from the original allocation was to get people equipped, including laptops, etc., for remote working. I guess if we're done with that, then a summary document would be fine, and then for what other issues, how much money do we think we're gonna need, and what are the anticipated, expenditures? Again, you know, we did the, emergency allocation, and it sounds like, at least on Nathan's end, it's not, it's, you know, it can certainly wait till Friday, but if yours is, you know, if your request, if you need, if there's an emergency that it's needed before Friday, I'm certainly willing to, you know, talk about that, today. But if we can get a little, documentation, and have that available Friday, I would feel better about that. But I'm not gonna, if we're gonna be short, I want our staff to have the tools that they need. So we did that
So
with the
my
original allocation, but I'm not hearing that we're out of money.
Well, and what I'm saying on that is that we are, because that original allocation has now been used up by IT. So other departments that come forward with needs that are unknown today, but I do need to get this budget amendment ready to have any of the emergency funds appropriated. So the sooner we act, the better for me, because it will take this about 3 weeks by the time we publish and have public hearings to get the money available.
So my suggestion would be that we go to each of the departments then and ask them to anticipate what they will need, so that we're preparing for the next budget amendment, and we also have something in front of us that directs what we anticipate the cost will be that they might need. That could be done, I would assume, before we meet again on Friday.
Okay, I can reach out to each department to ask them to provide that.
I think, well, my feeling, Stella, is if you're if you're out of the money that was allocated, so then it sounds like I would like a summary then of the IT, if IT used all that up. Now we have other departments that have needs. I'm willing to, you know, to reallocate additional funds. And then I would expect that we would get a report, because I assume you're not asking for it if you don't need it. So, I'm not
my
sure
thought
what,
was that,
I guess I'll defer to Dawn. Can we develop consensus today? Can we take action?
Do a motion. Yeah, we're in.
Just do a motion.
Okay, we can do a motion because it's on the agenda. So Stella, what was your request?
my request on Monday was to appropriate another $500,000 for potential needs by departments. And I understand that you guys want more reporting, but at this time I don't really have, it's just in anticipation of needs. We don't know today what we might need in 30 days. And if I don't have it appropriated, I can't expend it.
Okay, I've heard enough with that. So, Nathan, you heard, I would like a report Friday if possible, and you can get that through Stella or however you want to do it. But I'm willing to, at Stella's recommendation, to appropriate additional funds, which Stella, that's the equivalent of moving it from our savings account to our checking account. Is that correct?
It is, and it wouldn't be expended without coming before you with a specific request, probably. But if it's not available to be spent at the time, I can't act that quickly.
Okay. I think I have the information I need. I don't know if...
So we're not gonna make a motion to appropriate funds for a dollar amount?
I think we are.
Oh, good. That's what I'm hoping. I just need.
Could I have my questions answered then, please? So where is the specific, I am not aware that Stella was asking for $500,000. That I think is new to me right now. So do we have, could we think about this and ask for some greater detail and kind of look into this before we just send it on over? I understand that it doesn't mean it's going to be spent, but I'm asking for the difference between today and Friday at 1 o'clock to see if, the money is not going to go into quarantine. So to see if we can put together some reasonable requests from our departments. If they all say, I don't know, okay, but
That's probably what we're gonna have. So I would do what we did last time, do a bulk appropriation, and then we have good processes, we have good people in place, and they can use those funds to help the county citizens and help the county employees through this crisis, this emergency.
But the headline will be that the county puts another $500,000 into an account that they don't know what they're spending it on. And I have had citizens ask me about that. What are we doing? Why are we doing it? What's it being used for? Not everyone sees the coronavirus the way we do. When you're in smaller towns and out in the more rural part of our county, they don't see it this way. And they're very concerned about their inability to pay their property taxes. So I'm asking for 36 hours to develop a plan, and if it all is, we don't know why we need it, I guess we'll make that judgment on Friday. I won't be voting on this today.
That's fine. That's been consistent, so I'm aware of that. I think communicating to the citizens is good. It's key, but we are elected in times of emergency to provide services and to act. And the most important role I have, hopefully, is to be that leader. The second is to appropriate the county's tax dollars to help the citizens. They've already paid their taxes. It's already here. We have the funds. We need to just deploy those. And the other thing I'll make again, when you talked about property taxes, we are in such a good position because of our community development, our citizens that pay their property taxes. We have good fund balances. We can make these appropriations and we will not be raising taxes. We're a long, 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 long way from that happening. So I've got control of our finances, so does Stella, so does the auditor, so does the treasurer, and I get the reports, and we're in a very good position. What we need to do is give the people the tools and the resources to do their jobs with the citizens' funds. So I will be supporting any motion that my colleagues make to move this forward today.
But it isn't, it's about the opportunity to formulate deliberation and not just have another reaction that we need. We are talking about 36 hours. No financial position is going to change in terms of our fund balances and our status. So saying that we're considering that and we're asking for documentation, Dave, I don't know if you've seen the report that Stella emailed. I've seen that because I'm home and I've got the various computers open. We have a detailed report and accounting for what IT has spent. But to say that we're going to make these decisions without having the up-to-date information, that's just not, in my idea, that's not the way to spend the taxpayers' dollars. The 36 hours matters to money that we're in a good position on is concerning to me, that we don't need to be this responsive for fiscal matters. It comes up and it's decided immediately. We could show that we're being deliberate, even in a time of urgency.
And that's what they say they're doing in Washington, D.C., and everyone I talk about says they're dysfunctional. So I would rather be much more decisive and responsive to our employees who are paid by the taxpayers and the taxpayers' funds. So that's my last comment.
Yeah, I don't want our budget director to have to tell any of our departments that we don't have funds allocated for this emergency. So I'm satisfied with the way that the original request went, that there was a need, the documentation, I'm confident. I'm looking at the email from Stella regarding the IT expenditures. So we have the need was obviously there, the documentation is there, and the approval and questions can come when the, claims, come through. So we have processes in place and I'm very comfortable with that. So again, it's moving it from our savings account to our checking account. So, I'm prepared to move on this, so. Yes. I'm willing to go with, matter of fact, I'll make the motion, that we go with the recommended, amount from our budget director, 500,000. And, obviously the, appropriate documentation will be provided.
For fiscal year 21, fiscal year 20?
Fiscal year 20.
I will second that motion.
Okay, we're open for discussion. I think we've already had quite a bit, but, any further discussion?
None from me.
Okay, all in favor signify by saying aye.
Aye.
Aye. And opposed?
Nay.
Carried 2-1. Stella, you'll have your, allocation for the emergency funding.
Thank you.
Stella, if I could ask you, before you come before us again asking for $500,000, I would like to see that request be put in writing and submitted to us before the meeting. I think that's something that you can do.
Okay.
This was actually discussed, on Monday. So it's not like this came on us, at the last minute. We discussed this in a public meeting on Monday. And at that time, I wasn't, I didn't have the documentation from IT, and I wasn't acutely aware that we were out of the original funds. So I'm very comfortable with the action that we just took. But we did discuss this on Monday.
We discussed it in the same situation we are now with
Absolutely.
no formal written request.
We discussed it on
Nothing
Monday.
more comes. We don't have any requests ever from the budget director in writing. And that's a problem in the way we perform our job.
Well, if you want to hold a press conference afterwards, Ann, you feel free to do that. We have voted for this. We're moving forward. Let's go to the next issue.
I'll make a motion to recess for 2 minutes, and please have everyone from Zoom stay on the line.
Second.
I'd like to have it be for 5.
5.
5-minute recess. All in favor signify by saying aye.
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 Carried 3-0. Good work. I don't need to do anything here, Rich. Leave it.
muted the room.
Oops. Is that
Yep, you're-
okay?
Yep.
All right. Okay, we'll reconvene. It's 12:18 PM, and we are in item 2B on the agenda, COVID-19 budget and expenditures. I'll go back to Budget Director Stella Rundy. Stella, are there any other issues or requests to your knowledge?
There are none to my knowledge at this time.
Okay, thank you.
Thank
All
you.
right. Any other issues under the COVID-19 budget and expenditures item? Otherwise, we'll move to item 2C, which is employee pay and benefit changes due to COVID-19 response. And I think we'll go to our Human Resources Director, Dawn Sherman, for this.
Hi, thank you. So I have been working with some of the department heads and elected officials, and as I check in with them about operations, we've had 2 issues with closures and minimum staffing issues about not allowing employees to take off vacation time. So in front of you are memorandums of understanding to present to the unions upon your approval to extend the vacation extension cap. Currently, employees have 3 months after their anniversary. And so we're proposing that at the end of the declared emergency, we give employees 6 months to use their vacation that otherwise they would lose. And again, that's because we're not allowing employees to take off vacation. They're still accruing it. And it's just,
Suspension.
yes, it's just a suspension of it. It
Okay.
really, it does not have a dollar amount, a cost with it, because it's just giving them time to use the vacation that they earned, but we're not allowing them to use during the emergency.
Sounds like an easy
Well, there's a
one for
change
me.
with Sunnycrest.
Yes.
There's a change in Sunnycrest that goes beyond that.
Yes, we'll go to the Sunnycrest overtime as well, but for all the other ones, it's just the vacation cap, extending the time to use it.
And do you want us to deal with these individually? I notice there's different unions, different memorandums or of agreement or letters of agreement.
Actually, we can do that, if you let me, if I could address it. The secondary roads, the Teamsters representing the courthouse, the Teamsters representing the administrative deputies, and the County Attorneys Association, as well as the Deputy Sheriff's Association. All of those are the same, in which we are extending the 3-month versus, we're suspending, taking away people's vacation, and that we are going to extend the duration, the time that they can use their vacation, to 6 months after the emergency, after the declared emergency has ended.
And that would be declared by the Board
By
of
the board,
Supervisors.
yep. Once you end the emergency, that 6-month time period would start for employees to be able to use their carryover vacation.
I wish I knew when that was gonna be.
Yeah, yes, we do. And then I would like to take Sunnycrest separately.
Okay, so is there any, I guess before we do a motion to approve, is there any discussion on these? And you are recommending these, is that correct?
Yes, I am.
Any discussion?
None for me.
Ann, any discussion?
No.
Okay, motion would be in order, I think, to approve all of these, but we'll keep the Sunnycrest
We'll take that one
manner
next.
separately. So, anybody have a motion to approve? Hearing none, I'll make a motion to approve the letters of agreement for the all of the groups except for Sunnycrest Manor. We'll keep that separate.
That's correct.
Is there a second?
I'm sorry,
Oh.
I was reading. I will second your motion.
Okay, there's a motion made and seconded. Now we're open for discussion on these letters of agreement. Is there any discussion? Motion was made and seconded. All in favor signify by saying aye.
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 Carried 3-0. Okay, now we'll go to Sunnycrest Manor's, letter of agreement.
Okay, I have, Chris unmuted as well, so she can, comment as well. So the first one, and this is on page 1 of your handout, this is regarding overtime pay. This is Chris preparing when they're going to have to do a little bit more mandatory overtime. Currently, employees, are receiving 1.5 times their pay, which is the federal, standard, the minimum for it. She is requesting that employees that will be working overtime during the declared emergency would receive 2 times their pay. And it's to incentivize them, to take those extra shifts. And again, that would just be through the declared emergency, and then it would go back to the collective bargaining agreement, 1.5 times their rate. So Chris, do you have some comments you'd like to make?
No, other than that, I would like to begin this as soon as the supervisors approve this, as we're, as the staff short. I want to decrease the staff travels from home to work as much as possible. So in order to cut down on the 4-hour mandated shifts and switch them to 8, it is an incentive to change the overtime to double time. So I would like to implement this as soon as possible.
Chris, this is Ann. Obviously, this will have a budget impact. And my question isn't intended to be negative. It is intended to be an inquiry. Could you have Emily give us for Friday some idea of what the budget impact is for this? Folks will want to know that.
No, I don't have that. It's all up in the air right now. We're doing the 16-hour shifts this weekend. We're having staff stay in the motorhomes this weekend. We don't know how often and how long this will be. We don't know. We can take a mean wage. If we have to implement this on a daily basis, we will, to take care of our residents and keep them safe. So it's not a number that I'm able to calculate.
Emily can run a number for you, just even on the overtime, to show what this might be. And we can get, it doesn't have to be a hard number, but we should have some kind of a projection. I'd also like to know what stay in the motor coach means.
The 2 motorhomes are in our maintenance shop.
Correct.
The employees will work 16 hours and will sleep in the motorhomes. They will return to work. They will shower in our maintenance shop and return to work for 16 hours. They will do this for 3 days on, 2 days off.
Has that been announced to the staff? Are you currently doing this?
We're starting it this weekend.
And what has the employees' response to this been?
The employees' response has been quite willing. It's on a volunteer basis. It's not a mandatory thing.
Thank you.
We have many employees that have volunteered for this.
Awesome. Thank you. I would like to have Emily run some numbers.
Yeah.
I can take, yes.
Chris, Dave Baker. So we're actually, I mean, there is a number here. It would take a guess, but it's relatively small because it's the difference between time and a half and double time. Is that not correct?
Correct.
So it's not, we're not talking about double the wages. We're talking about the difference between time and a half for overtime pay and double time for overtime pay. If you go off an example, if you said $30 an hour at time and a half, it's 45. At double time, it's 60. So it's not the whole number. It's a partial number.
Correct, and I need 15 staff. So if I do my quick math on my Excel spreadsheet, if I need 15 staff that make an average of $15 an hour, they would have been getting 22, and now they're getting 30, so that's 15 staff times 8 times 16, so per day that's $1,900.
Okay.
So
Plus all the accumulated benefits.
And Chris, there's no way to determine when this crisis is gonna end. Is that correct?
that's correct.
And when we do declare that it's done, then this goes away. Is that also correct?
That is correct.
Okay. Stella, would this possibly fall under money that we would track for this pandemic, for the I know you're tracking
For FEMA?
Yeah.
FEMA,
Yeah,
for FEMA?
COVID, labor overtime cost, is eligible for reimbursement.
Okay. All right.
And we're
So
tracking that
as
in our payroll system.
So as Ann was saying, that 1920 times the FICA cost comes out to be $2,066 a day. Now, I'm not doing this every day.
2,200 or 22,000? 200.
2,200.
Yeah.
And I'm not doing this, this is just the overtime cost increase.
Right. I don't disagree. It's a great incentive. I just want us to have a budget projection. If someone wants to approve this today, I'm not going to stand in the way of that. I'm just asking that we always be trying to reflect this back to the budget so folks know we're being sensitive.
Okay.
So, Chris, could you tell us the benefit, and because I don't know that we've thoroughly talked about the benefit of this proposal. What does this do to benefit the residents that live at Sunnycrest Manor, and then obviously I think we know the benefit for the staff, but and this is you said it was voluntary, but what are the benefits for the residents of Sunnycrest Manor?
Okay, I'm going to give you an example of why we implemented it this weekend. We had 2 12-hour call-ins, which accounts for 12 4-hour shifts. In other words, 12 people would have been coming in and out of our building. Utilizing the 16-hour shift coverage, we have 1 to 2 people doing those shifts. That dramatically decreases the amount of people coming in and out of our building. That is our whole intent. We have to decrease the amount of people coming in and out of our building, in and out of our resident rooms.
Okay.
It's truly a great idea. Great administration, Chris.
All right. Any other discussion? I don't know that we've made a motion on this.
No, because there's a couple other.
Oh, okay. We're not done yet. All right.
And the second part of this, under their overtime, their collective bargaining agreement has it within any 7-day period, an employee who works at least 4 hours of overtime would not be eligible to have mandated overtime upon them within that 7 days. So this is giving management that flexibility in those cases where they are going to have to do mandatory overtime, that right now the employee can say, I've already had my 4 hours, I'm not going to work it. Obviously that does not work in times of emergency in a minimum staffing. So Chris has asked that we temporarily suspend that provision where Chris would be able to mandate overtime above and beyond what the 4 hours every 7 days. Is that correct, Chris?
That is correct.
Okay.
Chris, how are you taking into account the employee's family, childcare issues, those kinds of things?
Absolutely.
Yeah, and it would always be volunteer first before we would have to implement this approach.
Okay, any other discussion?
Chris, can you ask Emily to get us a projected budget update? Maybe Friday's not possible, for Monday?
For what request, Ann?
Just to look and see what this projection might be on the budget. I know she's probably already running these numbers. I'm just asking to have a look at a draft.
For the overtime, for double time?
Yes.
For the difference between time and a half and double time?
To implement this, and also looking at, you're going to be doing these shifts. I'm just asking for an update and budget draft on this.
Okay.
Okay, any other questions on the document?
And then we just have one more on the back of page 1.
Oh, okay.
This is, Sunnycrest has a slightly different time off accruals. They have the PTO versus individual vacation, sick, and holiday time. So this is very similar to what we requested of the other bargaining units, in which with Sunnycrest, once they hit their bank max, they stop accruing vacation or PTO time. So again, with not allowing people to take PTO, more and more people are gonna get to that max and stop accruing it. So what we're proposing is to increase those caps, so the time that they are not allowed to use it, they can still accrue some, and then giving them time after the emergency is ended to utilize that time. So it's a different approach on it, but the same concept of the other agreements. So we ask that you approve the increase in those bank maximums to support that employees are not able to take their time off.
So increase the maximum balance of PTO hours during this emergency, and then they'll be allowed to taper it back down to the original amount.
Correct. Yep, each one of these provisions has a sunset in it, whether a specific date or the end of the declared emergency.
Right. In this case, I see January 8th of 2021.
Yep.
Okay. Any other discussion, comments? You'd like a separate motion on this, is that correct?
Yes, please.
Okay, so there's a letter of agreement between the Board of Supervisors and AFSCME Local 2843, representing the employees of Sunnycrest Manor.
Make a motion to approve the memorandum of understanding as presented.
And I will second that.
Motion made and seconded to approve the memorandum or letter of agreement. All in favor, signify by saying aye.
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 Aye, carried 3-0.
Thank you very much for that. Yep. I appreciate that.
Thank you.
Well done, by the way, Dawn, thank you. Thanks, Chris.
Thank you.
Okay, moving forward, I guess we're still in, is there anything else under employee pay and benefit changes due to the COVID-19 response?
No, not at this time, but I will continue to work with departments. There have been other suggestions and ideas, all dependent upon the duration of the emergency. So, but nothing at this time.
Okay, and then we have item
Could I ask the chair if we could also readdress the COVID emergency response team update?
Sure, go ahead, Ann.
So emails are going out from Tom Berger asking for a poll of the cities to indicate whether they are in favor of a shelter in place and what the repercussion of that might be. That was not addressed by Tom Berger in his presentation to us this morning. I know that he's still present, and if he can comment in terms of the purpose of this, and I guess I need some context for it. It appears that it was at the request of Supervisor Wickham.
Maybe I'll comment first, and then Tom can jump in. So yes, I spoke with Tom this morning related to that, and asked him if he would be comfortable communicating to the clerks and or the mayors along with his EMS committee, which is usually that same group, and just described what's kind of in the email, and he said yes, and then he forwarded that email. So, Tom, if you have anything else to comment.
Chair Baker, this would have been in your email box. It was sent at 11:58 this morning. And I've asked Tom Berger to please include a request for an update as to how the cities might feel they're going to enforce any such shelter in place. But I think we should take a minute and have you be able to read the email so we all know what it is. And I welcome any comment Tom would have and any update. Looks like the responses are due back this afternoon. So Mary Hobble, if you're listening, you'll want to get a response back as the clerk for Sageville.
Yeah, I don't see it, and so don't know if I got it. So, and I've been busy chairing the meeting here, so trying to focus on what's in front of us. So if Tom wants to comment, that's fine. Otherwise, I think it probably is something for the next meeting, and maybe goes towards my original question was just, making sure that we are communicating with the small town mayors, clerks, and elected officials. So I think that sounds like that's what he's doing, but I do not have that email. So.
Right. I would prefer that be at the request of the Board of Supervisors and not one individual supervisor.
Yeah, it was
and
it was my opinion, so it was my conversation with Tom Berger, and the email went out to Tom. And, as I mentioned today, one of my main messages is unity, and getting to those local officials and saying, we are interested in your communication, we're interested in understanding what your needs are. I was very, very pleased that he did that.
Right, but you need to focus on the unity of the three of us. Much of the community's take on this will be by whether or not we are performing our jobs in unity. So that you need to not skip over the fact that we need to be equally informed about things. This was plenty of opportunity this morning for this issue to be addressed before this board as part of a COVID-19 emergency response and discussion, might I say, that Tom Berger gave to us about cities and the outreach. So, it's important that we have the ability to build trust and unity between three supervisors.
Yeah, agreed. Yeah, no, I mean, obviously, unity means all. So I very much agree with that, and very much in favor of the discussions we're having now.
Okay.
That's why I come to work.
Tom, do you have any other information you want to bring to us about this?
No, I just forwarded on to try to get a consensus or try to see where the if it's discussion that's been had in their own, that they had out in the communities or what it is. That's just where I was requested to send the email, and I would do that. That's kind of how I've done that before in other disasters, I guess. So it's communicating with the board. I mean, my emergency management committee, basically.
And how likely is it that the email to 31 folks are going to be responded to by this afternoon? I mean, my experience is that those mayors are not, in some of the small cities, don't necessarily check their email every day.
Right, and then I would, Jay wanted the email or report back by this afternoon, so I would do the email, the ones that a lot of them do check it, and the other ones I would have to follow up with on their cell phone or a phone call. So try to get that information.
And do you have time to do this?
I got help today, so yeah.
Okay. It sounds like this falls under what we talked about originally about keeping our small towns in the loop and staying in communication. And Patrice Lambert and Tom Berger both said that they're doing that, and so I think having that contact is important. So I think we'll move to item 2D, Board of Supervisors staffing. I'll turn this over to Dawn Sherman.
So you have in front of you a draft job description based on the feedback that I have received over the last 3 or 4 days from the board. Excuse me. Essentially, what I was getting was there's a communication piece. So I was drafting this as this person would be your communication hub, gathering the information, disseminate that both to you and to the public, to staff. They're kind of that depository of information. That's what I kept hearing. At this point, the feedback I was receiving was do this on a limited basis, evaluate it after that. Thank you. And then if it needs to expand, if it needs to continue on, we can do that at that time. And so I would recommend that this person report directly to the board just to keep those lines of communication open, not to slow anything down. So that's how I've drafted this based on the feedback that I've received from all of you the last few days.
Dawn, you were going to reach out to Story County to look to see how they organize their Board of Supervisors office. Does any of this that you've given to us, does that reflect that conversation or paperwork you might have received from them?
Yes, I did not reach. I just went onto their website. They have all of their job descriptions. They have 2 directors, an internal and an external director that both report to the board. This one is mirrored off of their external director. The internal one would be more of the human resources role that I also play. It focused more on human resources and having reports through some of the departments. So what you see here is very similar to the Story County external director that reports to the board. As well as adding some additional communication pieces, having this person be more of the public information officer, again, helping compile and disseminate that, whether it be press releases or just internal updates to the board, to other staff. I did put in some language of them researching some legislation. I know that has been discussed in the past, and we have been working, or the emergency management team has been working with Terry Goodman. I would see having this person take some of the county role for that, instead of having Terry do that, reaching out to the legislators, have this individual. And working with Terry as well.
Yes, thank you, Don, for that. Open for comments, discussion. I was able to meet with Dawn, and I'm, as I stated Monday, have to be convinced to add staff. In this case, having someone with the talent to do this, to handle communications during this emergency time is certainly makes some sense to me. I probably would lean, if we're going to do something, and I think from previous discussions, my counterparts are on board with this. I would look at maybe like a 6-month type thing to start with, and then if there's value, I think we could evaluate it at that time. If we think that there's value beyond the emergency period, I would, I think it would depend on the how it worked out, the performance of the individual, how Dawn feels about it. But in my discussions with Dawn, and which means a lot to me, is that there would be some value, because it's of the emergency situation that we're in, and needing to have county position handling our external issues with the media, direct contact with the crisis team. So I guess I'd want to hear some more comments from Supervisors Wickham and McDonough on where they're at with this.
Well, certainly I'm not an HR expert, which is why it's wonderful to have Dawn with those skill sets to look at putting this together. In terms of duration or time, I am fine with it being on an interim basis. To say that I think any such person will prove their worth, Dave, and you'll be able to explain to citizens how far superior we are and responsive that we can be with a person who can facilitate things for us, policy, administration, and so forth. I think we're not really done with the job description, in my opinion. I'm having great difficulty, Dawn, with any type of agency. I do not want this person to be acting as the Board of Supervisors agent. That is a different level of responsibility. They could then bind us to financial commitments. And I'm certainly not thinking about this person having any ability to speak on our behalf and to make any kind of binding agreements or understanding. So I think that the agency is not the direction I would go. I'm looking at the person being more of a someone who clearly has limited ability to bind the supervisors. Clearly, I mean, fiscal matters would have to come back to us for any kind of resolution and action. But I'm worried that if we give this individual the ability to function with agency, I mean, it specifically states that in the job description that we're creating implied agency or express, where we're going to have to follow up behind what they say. I'm not interested in that. So looking more towards someone who is in a role that is making recommendations to us, doing project-based work that comes back to us for final decisions. So, and I also think we want to have some of this be in concert with human resources. That I would like to be part of the job description, that we intend that they would work with you to for communications. Some of that needs to be together with you as well. So some language to say that they would be working with HR jointly, or whatever language you feel obviously keeps your authority as well. But I didn't know if we could look at maybe Lynn County. They have a director of policy and administration, seeing if there's other styles of job description that don't rely so much on the autonomy of the person to act without our direction and approval. I also had concerns about the politicalness of this, because I know that I, as a citizen, wouldn't want a county employee to have a political hat. And when we look at whether or not someone's going to be helpful to reaching county goals, they can do that through logistics and through, the common sense evaluation, but I don't want them to be evaluating things in a political sense. I don't want politics to be in play here. And if that's naive, so be it, but I don't want that language to be in the job description.
Is that in there, Ann? I'm not seeing that. Unless you're talking about
I can point it out to you. Job duties and responsibilities, the final line, analyzes the impact the political, problematic, and policy changes will have on county operations. I don't wish to have them decide on any or make any recommendations on political. This should be a non-political person. They can work with legislature and other elected officials, but not on politics.
By politics, are you talking about bills, for example, coming out of Washington, D.C. or Des Moines?
I think that legislative duties are in another paragraph here. I'm just saying I would strike the word political, I would strike that.
Well, I would
Yeah.
say
And
this,
then-
that I'm kind of,
Paragraph under.
skeptical
job
and on the
duties.
fence on this. I don't know if we're reviewing this, in time, and apparently you haven't had a chance to go over this, so, why don't
Well, I have it, but
get with Dawn
Right.
and,
no.
bring back another
Steve, I think that-
version, because it sounds like you're not supporting this, and the other day it sounded like you were, so, maybe I'm.
Now, you're misunderstanding.
Oh, okay.
I support the person, I support the job, whoever that person is. I support the importance of the position. We have to decide what we want that position to do and how we want, what can that person do for us? I am responding with kind of an alarm about any kind of agency. The summary description says that they will act as an agent for the board, ensuring proper administration of affairs of the county. I don't think we want to give agency. We want to find another word that, we're going to need the county attorney to give us a little bit of discretion on that too, some discussion, because we don't want to inadvertently create a city management style of government where that person's out signing contracts because they feel they have agency ability.
Yeah, I would agree. I think that one of the easier things we could do is just at the bottom, just state that this position does not by any means give power and authority delegated by the Board of Supervisors to speak for or act for the Board of Supervisors. So similar to almost all of our other directors that have budgets and have, ability to go out to the public and speak.
Right.
If it's generally designed to be, as of right now, if the proposal is that let's, have it for 6 months, I would absolutely have them report. I would think my position would have them report to Dawn Sherman. So if, unless it's a longer term position that the board wants at this time, having them be independent and report right to the Board of Supervisors within a crisis is probably not a good idea for a new employee within the county, even as talented as I think Mr. Raber is. So my changes would be have a report to Dawn Sherman, and the other items I'm generally comfortable. I'm comfortable removing the word political as well, so I think that's a good catch. And the basis of what is here seems good, but if you put that disclaimer at the bottom, I think we're good to go. I'm good to go, at least.
I can update based on today's discussion and propose salary. I haven't had time to do externals. I know I would like to look at our internals comparables a little bit more, given what some of our other professional positions, they have a lot of legal responsibilities with audits and budgets and those type of things. And I want to make sure that we're putting them in the right place there. So if that would be okay, I could finalize this and develop a letter of recommendation for you for Friday.
Okay.
I'm not at the finalizing stage. I asked you this morning, Dawn, we ran out of time to look at. I have not seen the job description that you were once given and we recruited you from. Also, with Stella, I think that there's some other language that we might want to look at in terms of our relationship to this professional person that would benefit having a little bit more research done, a little bit more groundwork. And I want that person to report to us. I do. Otherwise, if they report to Dawn, then we've just added more to her day. And and the purpose of this is saying that she needs to have another division that's taking over the administrative functions of the board duties. So I'm not sure why I want that person to report directly to Dawn. I think we have a little bit here of a hiccup in terms of what this person's performance might be. And I am very much aware that Supervisor Baker is reluctant to take on a new employee, that you have been consistent about that in the many months I have worked with you. So, and I understand that it needs to be the time frame that relates to an emergency. You're reluctant to do this, and the proof's going to be in whether or not you feel that we're getting true value for the citizens. But I want that person to report directly to us, maybe in part for that purpose as well. Can we evaluate whether or not this job, and I haven't drafted any of this thinking of a particular individual. I'm trying to say, that we're looking for the fit that we need for the need that we have. So who's going to fill that spot? And not looking at a certain individual who may or may not be available and we may or may not want to hire or make an offer to. So Dave, I don't know if any of those things help you feel like we can put this into context of the need is because of an emergency situation and it's an interim position. I would agree with Supervisor Wickham. 6 months is a little short because we know that the digging out of this is going to take some time too, some unwinding of various matters as the economy gets back into place. I would look at it to be a 12-month contract.
Well, with that term contract, does that mean it would be a contracted employee or an employee of the county?
Well, there'd be two things. If you would want to offer benefits, health insurance benefits, IPERS, it would not be a contracted employee. All employees in the state of Iowa are at will, so we can terminate employment for any cause. So you can make them just a regular full-time for 12 months, and then that would be the time that we would end the employment agreement.
That makes the most sense to me.
I would, I've gone, I think, from being unconvinced, and after talking to Dawn, that at least during the time of this emergency, that we may need more help, add person to our team, leadership position. I'm okay with that. I'm a little confused. We want them to answer to the board, at least Supervisor McDonough does, and I think I'm probably okay with that, but I don't, it also sounds like we're trying to limit the independent judgment. Now, I agree they shouldn't be acting as an agent, shouldn't be involved in politics. When Ann was talking about political, I thought she was talking about legislative, and that appears to be in a separate area. So I'm okay with making those revisions. I would like, I don't think we need to pull the trigger on this today. So I guess I would like to see what Dawn's recommendations are, and if Ann and Jay have any further suggestions into the job description between now and Friday, if they could do that, and then get a clean document out to us with a salary recommendation. Again, I said my preference was 6 months. I'm not gonna, I won't hold this up because of that. Again, after having discussion about the need, I'm okay with that, and won't get hung up on 6 months or 12 months or whatever the case may be. So I think we have consensus to move forward, and it sounds like Ann and Jay have some good input into what should be in the document. I would like to look at it before the meeting on Friday and see if I have any questions. I'll commit to meeting with Dawn sometime before the 1 o'clock meeting on Friday.
We'll send it out to all of you. It won't take long to update, so I appreciate your direction on this.
Okay. Does that sound okay?
I have another question. Well, I have another question for the board. So if we proceed with this job description and we look to hire a person, at some point we have to be deciding whether we're going out to seek applicants, which would be my preferred way, with short time window for response to see who's available, as compared to making an offer to a particular person. I would like to, because it's an emergency situation, I think we have the ability to hire someone that we know. But I would like to see us at least post the job and look for other applicants to see, to be fair-minded about this. It's a government position. So I would certainly appreciate your feedback.
I would only do that if you are seriously intending to review and give consideration to those applicants. Otherwise, you're wasting their time and really you're just not being genuine. So that would probably push this back at least a couple weeks.
What is the posting process for county positions, Don? I mean, does it get posted internally first and then it goes external?
We could, that's just admin policy. You could waive those provisions and we could do it for a week. We could, like I said, you can waive just the recruitment process and just make an offer if you'd like. But we can be flexible with that, especially with an emergency situation to fill this quickly.
Okay.
Well, I think we should, go ahead, Dave, I'm sorry.
Well, I was gonna say, if we do hire somebody, if somebody sticks out, and we decide that's who we wanna hire, as an at-will employee, if it doesn't work out, we can, eliminate the position. I hate to talk about terminating the employee before, she or he starts, so it sounds like we're hedging our bets, but I think whoever we hire, we should take a good look and, and make sure it's the right person, so. I'd be interested to see what Dawn's recommendations are. She's the HR professional.
I would agree.
Well, I would always say I would recommend a recruitment, because you want to be able to cast a wide net, but I'm also aware of the timeliness of it, and this may not be the most appropriate recruitment tactic in this situation. Normally, I would say take your time, finalize your job description, your pay, cast a wide net out, get the best talent out there. That could take weeks and weeks and weeks. So that I would not necessarily recommend that at this time. If the intention is to fill this very quickly and have this person start very quickly. I don't know if individuals have to give notice to other employment, depending on the individual. But yeah, my regular answer would be different than this situation.
Right. I mean, it sounds like if we do go through the full process, by the time we get through recruiting and interviews and such, we may not need the position as an emergency position. So I think that's.
I know this was Supervisor McDonough's lead a few months ago, and so I would still allow her to lead. So however she wants to lead the process, I'm willing to follow your advice and counsel.
Well, certainly this was not what I was seeking in terms of professional assistance to decide things, within 48 hours. But I think, Dawn, at minimum, you should be meeting we have one prospective candidate, and maybe we have overstated that. I don't know the discussions with Ed Raber. I think Jay and Ed have visited. I've followed by catch-up phone calls. So just looking at perhaps if this individual wishes to visit with you to do some minimal screening and look to see if you feel that, you're going to make a recommendation to us, I would like to have us run through an abbreviated format of some HR principles. I think it's not smart to just simply disband. It will seem as though we're hiring friends, and that's certainly not the intent here. I think we are fortunate to have a person with ability in the community at the right time in the right place, and it might just be one piece of good news. But I'm not comfortable saying that to the county at large that that's what we should do for final decision.
So I would be happy to reach out to him. It is very helpful to have a job description in doing that. I had a brief conversation with him on Monday, but now having the job description, it provides me the opportunity to really direct questions to gauge if he is the right fit for this. So having at minimum, even this draft would help me to do that. So I will reach out to him before Friday and have a little bit more in-depth conversation regarding his his knowledge, skills, and abilities, and as they fit to, this job description. And I could give a recommendation or some feedback as well on Friday.
Okay,
Dawn, I'm happy to look with you quickly this afternoon. If you could send to me those things we talked about this morning. So my comfortability is increased. I can also reach out now that I see some direction and look at other, if I can get a county to respond. I mean, we're all under emergency situations.
Yes, I can get that to you this afternoon. I've already pulled some of it before the meeting.
okay,
Super. Thank you.
all right, thank you. We'll look for more,
And I will copy
information
you all on
and a revised document.
Yep, absolutely. I'll put that on the agenda.
I do have one other, I want to circle back, apologize for this, but we had the discussion the other day about hand sanitizer and being made by a local provider, local employer, and I was asked to follow up with Rick Dickinson from Greater Dubuque Development Corporation, and I did, and he suggested that I contact Lance Hummel from Higley Industries, and Mr. Hummel is poised to move forward, and I think it involves buying alcohol by the tanker, and I think there's other entities that are also interested in this, but this would be a way, and we've established that hand sanitizer is a commodity that's hard to come by, and that Tom Berger had indicated to us that he's not able to get through his channels. So I guess I wanted to have a discussion on you know, how do we proceed? We have a Dubuque County employer that is willing to add staff, I think expand their facilities, and you know, start doing this. Just, do we want this now? Do we want it 2 months from now? Do we want it, you know, I mean, the need is now. So how do we proceed with this? I guess
I would have them get a proposal to the Board of Health and have them review it as soon as possible. And my recommendations would be to move forward in a progressive manner to secure this for the community. It's a health resource. That's why we funded additional dollars for the health department. And this is sanitation that keeps people healthy. So I would move quickly, but get that to that department, not the Board of Supervisors.
Okay.
I think that was my recommendation Monday.
All right.
Can I weigh in?
I'm sorry, Ann?
I said I'd like to weigh in if I might. I have the same hesitancy I did before. Certainly, we know that there's need in the community, but I am not inclined. I thought our last conversation was this individual was already in the process of doing this because they're shipping to Ohio. And so we would just be we would be placing an order for Dubuque County need. Certainly we need to act quickly to fill the need for the emergency management team. Tom Berger's told us he has an outstanding order that's unfulfilled for 250 bottles. That's just a basic need. Individuals in the community are asking each other on social media chatter if anybody has sanitizer they can share. So it's a need in the community. I don't want to be the entity that creates this person's business plan. I'm not saying that we want to go forward and have them make a proposal that they're going to refit their enterprise at the request of Dubuque County. So it's either one or the other. Either they're already operational and filling orders for Ohio, or they're not.
The request wouldn't, it's their request to us. So it's their request to us, do you want this? And I say, let's get it to the Board of Health. Let them decide. So I'm with you. I mean, I'm waiting for the Board of Health. They just get through that step, and then it's an appropriation that they would make.
Well, I understood Supervisor Baker today to say that we need to get them a commitment for them to change operations.
I'm not interested in any more details, I guess, at my point, so I'm done with the conversation.
I was asked to follow up.
Dave, right.
And I
So what
did.
do you know?
So, he, obviously, if he's going to expand, business, he's gonna add staff and add, he apparently needs more room. I don't think that's our problem. We want, I guess the question for us is, do we want to provide hand sanitizer for the medical community, our hospitals, our doctors, our nursing homes? There's a shortage. Tom Berger says he can't get it. So do we want to wait until we run out and then scramble, or do we want to be proactive and put an order in from this Dubuque County employer?
Is that a joke question?
No, it's a comment and a question. So,
I can't hear Supervisor Wickham anymore, so he's closing up his shop. So why don't we look at, if we have any idea what we feel the need is for us to purchase? Are we, again, 250 was the number requested by Tom Berger.
I think there's a suggestion that we send this to the Board of Health. Ann, are you okay with having contact Mr. Hummel and tell him to get a hold of the Board of Health with his proposal?
I think if we can connect the Board of Health to a local vendor to fill an emerging need, that's great. Okay. We also have a rapidly developing need for thermometers. We heard that from Childcare. We're hearing that from citizens. I'm hearing that from immigrant population. So we might ask the GDDC, as well as they did for N95 masks. We might say, do folks have, is there been some person who has hoarded? Or do we have them in the community as well, that we don't have thermal scanners and we don't have thermometers? So that's perhaps just as critical need as the hand sanitizer.
Yeah, and I think that's fine. We can reach out to Renee Poppy at Medline. I think they're a significant provider in the medical arena. But I think on the sanitizer issue, I think we'll go forward with having him send a proposal to the Board of Health. And he hasn't offered to make thermometers, so I think we'll have to look elsewhere. And I think that would be Patrice and Tom would have to, include that in their outreach. Right, is there anything else?
Yeah, the last just question is, I know there's a lot of staff members on here and obviously members of the community, so, I thank you for your service. I thank you for your attention. I know many of you are working nights and obviously the weekends. Pace yourself, do your best to get your rest, best to communicate with your family, but we greatly appreciate what you're doing, and we will get through this time together.
I concur, and we have great staff, dedicated staff, great public servants, and for example, the folks at Sunnycrest Manor. It is the equivalent of a firefighter running into a burning building when they're going to work. So hats off to all our staff, and we will get through this. We just need to keep pulling together.
So as the third supervisor, I would just use my new sign-off tagline designed by our IT director, which is to thank everyone and to say that we'll see you on the internet.
Okay.
We need a motion to recess till Friday at 1.
Motion to recess
until Friday.
Okay, there's motion made and seconded to recess till Friday at 1 o'clock. Any further discussion? All in favor signify by saying aye.
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 Carried 3-0. Thank you.